Check 1, 2.
Yeah. Good morning, everyone. I'd like to call the Thursday, March 19th meeting of the Human Services Committee to order. And now we are going to recess. So my apologies. We're going to need folks to head out because we're going to continue caucusing, and we will let you know when we start back up again. Thank you. We are in recess.
Madeline is allergic to strawberry. Oh, okay, so she's.
All right, good afternoon. I'd like to call the Human Services Committee meeting back to order. Welcome, everyone. Good to see you. Any remarks from my good chair, Senator Lesser?
I'll be brief because we have a lot to get through today. I just want to thank the members and the public for their comments. I also just want to acknowledge that one of our members, Representative Ann Hughes, is saying goodbye to a loved one and going through a tough time. And we want to extend our very best wishes to Representative Hughes and her family at this time. And we will continue to support her.
Thank you, Senator Lesser. Representative Case?
Let's get going.
Okay, great. Here we go. All right, we are going to go to number 2 on the agenda. House Bill number 5357, an act concerning residential care homes. Do I have a motion?
So moved.
Do I have a second? This is a JF to the floor. Representative Case?
Madam Chair, I move that we move this on the consent oh, we have to build the consent calendar first.
If you say that, then we'll.
I would like to begin a consent calendar and build this onto it as the first bill.
Wonderful. Wonderful. Without objection, we will add number 2, House Bill 5357 to the consent calendar. Moving on to number 3, Senate Bill number 87, an act strengthening nonprofits. This is a JFS to the floor. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Kitt. Representative Case.
I move this to the consent calendar.
Without objection, we will move Senate Bill number 87 to the consent calendar. My apologies. We're going to stand at ease.
Hold on, Madam Chair. Thank you.
Did we skip one?
Yeah. You skipped one.
Okay.
We've done number 2 and we are currently on number 3.
I object to because putting that on consent.
Yeah, no, he's.
Okay, so number 3,
Madam Chair, let's hold that one. Let's move on to the next one. Hold it. Who has a second? Okay.
no, so we'll just discuss this one if that's fine. All right, so we're on number 3, Senate Bill number 87. There was a motion made by Senator Lesser and a second made by Representative Kitt. Any conversation? Seeing, yes. Oh, all right. Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JFS SB 87. Representative Gilchrist,
Yes.
Senator Lesser,
Senator Lesser, yes.
Representative Case, Representative Case. Oh, hold. Okay. Senator Perillo, Representative Comey, Senator Marr, Senator Anwar, Representative Butler, Representative Dathan.
Yeah.
Representative D'Amico, Representative Fortier,
Yes.
Senator Gaston,
Senator Gaston votes yes.
Representative Hughes, Representative Johnson, Representative Kitt,
Representative Kitt votes yes.
Representative Master Francesco, Representative Meskers,
Representative Meskers votes yes.
Representative Pizzuto,
Rep Pizzuto, no.
Representative Santiago,
Yes.
Representative Scott,
Representative Scott votes no.
Representative Shake, Representative Stewart, Representative Stewart. Representative Vale.
No.
Do any wish to now vote that did not previously vote?
Representative Case votes no.
Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes.
Thank you.
Representative Stewart votes no.
Thank you. The roll call is now complete.
Thank you, Madam Clerk. We will hold the votes open. We don't know until what time yet. We'll announce that later on. All right, moving to number 6 on the agenda, House Bill 5354, an act concerning Medicaid pharmacy audits. This is a JFS to the floor. Do I have a motion?
So moved.
Second.
Moved by Representative Case, seconded by Senator Lesser. Representative Case.
Madam Chair, I move this to the consent calendar.
Yes. Representative Vale.
Is there an LCO number?
On the S language?
Yes.
Yes, the LCO number is 3469.
Thank you.
You're welcome. All right, without objection, we will add House Bill number 5354 to the consent calendar. Moving on to number 7, Senate Bill number 329, an act expanding Medicaid eligibility for older adults with disabilities. This is a JF to the floor. Do I have a motion?
So moved.
Moved by Representative Case, seconded by Representative Comey. Any discussion?
Madam Chair, I move this to consent calendar.
Wonderful. Without objection, we will move Senate Bill number 329 to the consent calendar. We are now going to number 11, House Bill 5480, an act concerning peer support services under the Medicaid program. This is a JFS to the floor. Do I have a motion?
Second.
Moved by Representative Dathan, seconded by Senator Lesser.
Madam Chair, I move this to consent calendar, please.
Wonderful. And this is LCO 3211. Without objection, we will move House Bill 5480 to the consent calendar. Moving on to number 13, House Bill 5484, an act expanding transportation options for home care clients. This is a JF to the floor. Do
So
I have a
moved.
motion? Is there a second?
Second.
Moved by Representative Case, seconded by Senator Lesser. Any conversation?
Madam Chair, I move this to consent calendar.
Without objection, we will move House Bill 5484 to the consent calendar. Moving on to number 17, House Bill 5487, an act establishing a career pipeline program for American Sign Language interpreting and increasing state assistance for persons who are blind or visually impaired and deaf. This is a JFS to the floor, LCO 3458. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Comey. Any conversation?
Madam Chair, I move this to consent calendar.
Wonderful. Without objection, we will move House Bill 5487 to the consent calendar. Going to number 18, House Bill 5481, an act concerning medical assistance for patients receiving hospice care at a short-term hospice specialty hospital or a hospice facility. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second?
Second.
Moved by Representative Comey, seconded by Senator Lesser. Any conversation?
Madam Chair, I move this to consent.
Wonderful. Without objection, we'll move House Bill 5481 to consent. Moving on to number 19, Senate Bill number 430, an act codifying the Americans with Disabilities Act. This is a JF to the floor.
Second.
Moved by Representative Kitt, seconded by Senator Lesser. Any conversation?
Madam Chair, I move this to the consent calendar, please.
Wonderful. Without objection, we will move Senate Bill 430 to the consent calendar. Moving on to number 20, Senate Bill 433, an act expanding long-term care options. This is a JF to the floor. Is there a motion?
So moved.
Moved by Senator Lesser, seconded by Representative Dathan. Any discussion?
Madam Chair, I move this to the consent calendar, please.
Wonderful. Without objection, we will move Senate Bill 433 to the consent calendar. Now we're going to number 21, Senate Bill number 431, an act concerning palliative and hospice care in Litchfield County. This is a JFS to the floor, LCO number 3456. Is
JF or JF?
JFS.
Oh.
Is there a motion? Wonderful. Second,
Second.
moved by Representative Meskers, seconded by Representative Johnson. Any conversation?
Madam Chair, I move this to the consent calendar, please.
All right, without objection, Senate Bill number 431 is moved to consent. Now going on to number 22, Senate Bill 429, an act concerning Medicaid reimbursement for emergency medical transportation. This is a JF to the floor. Is there a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Comey. Any conversation?
Madam Chair, if there's no objection, we can move that to the consent calendar.
Wonderful. Without objection, we will move this Senate Bill 429 to the consent calendar. Moving on to number 23, House Bill number 5556, an act concerning complex care service delivery for young adults with co-occurring mental health and intellectual disability or autism diagnosis. This is a JF to the floor. Is there a motion?
So moved.
Moved by lots of people. Moved by Senator Lesser, seconded by Representative Johnson. Any discussion?
Madam Chair, I move this to the consent calendar, please.
Okay, without objection, we'll move House Bill 5556 to the consent calendar. Moving on to number 25, House Bill number 5557, an act concerning eligibility determinations by the Department of Developmental Services. This is a JF to the floor. Is there a motion?
So moved.
Moved by Senator Lesser, seconded by Representative Dathan. Any conversation?
Madam Chair, I move this to consent calendar, please.
Wonderful. Without objection, we will move House Bill 5557 to consent. Now on to number 26, House Bill 5558, an act concerning the Department of Developmental Services Abuse and Neglect Investigations. This is a JF to the floor. Is there a motion?
So moved.
So moved by Representative Shake and seconded by Representative Dathan. Any conversation?
I think we can move this to the consent calendar, please.
Right, without objection, we will move House Bill 5558 to the consent calendar. Number 27, House Bill 5562, an act concerning various revisions to human services statutes. This is a JFS to the floor, LCO 3460. Is there a motion? Is there a second? Moved by Representative Comey, seconded by Senator Perillo. Any conversation?
Madam Chair, consent, please.
All right, without objection, we'll move House Bill 5562 to the consent calendar. Now on to number 29, Senate Bill number 499, an act concerning Medicaid rate increases. This is a JF to the floor. Is there a motion?
So moved.
Okay, moved by Rep. Kitt, seconded by Rep. Johnson. Any conversation?
If there's no objection, we can move that consent as well.
Okay, wonderful. Without objection, we'll move Senate Bill 499 onto the consent calendar. On to number 30, Senate Bill 500, an act concerning a state-funded caregiver program to assist parents of children with autism spectrum disorder. This is a JF to the floor. Is there a motion? Second? Moved by Representative Dathan, seconded by Representative Johnson. Any discussion?
We can move to consent.
Okay, without objection, we'll move Senate Bill 500 to the consent calendar. Moving on to number 32, Senate Bill 495, an act concerning long-term care. This is a JF to the floor. Is there a motion?
Second.
All right, moved by Representative Dathan, seconded by Senator Perillo. Any conversation?
We can move that to consent as well.
Wonderful. Without objection, we'll move Senate Bill 495 to the consent calendar. Now going to number 40, Senate Bill 480, an act targeting fraud, waste, abuse, and corruption. This is a JF to the floor. Is there a motion?
So moved.
Is there a second? All right, moved by Senator Lesser, seconded by Representative Johnson. Any conversation?
Madam Chair, we can move that to consent as well.
Okay, without objection, we'll move Senate Bill 480 to the consent calendar. Now on to number 45, Senate Bill 331, an act concerning step therapy requirements for prescription drugs covered under the Medicaid program. This is a JFS to the floor, LCO 3464. Is there a motion?
So moved.
Moved by Senator Lesser, seconded by Representative Dathan. Any conversation?
Madam Chair, that can go to consent as well.
Thank you. Without objection, we will move Senate Bill 331 to the consent calendar. I would now like to go to number 4, House Bill 5040, an act implementing the governor's budget recommendations for Health and Human Services. This is a JFS to the floor, LCO 3210. Is there a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Senator Perillo. Any conversation?
Madam Chair, let's move this to the consent calendar.
All right, without objection, we will move House Bill 5040 to the consent calendar. All right, we are now going to go to number 37 on the agenda. I'll let y'all get there. Senate Bill number 3, an act concerning healthcare affordability. This is a JF to the floor. Is there a motion?
So moved.
Moved by Senator Lesser, seconded by Representative Johnson. Any conversation?
Yes,
Yeah. Oh, okay.
if you want to put it off for consent, I will, happy to refer.
Senator Lesser.
Certainly wouldn't want to stand in the way. Yes, thank you. This is Senate Bill 3, and this is part of our committee and the state Senate's response to the passage of HR 1 last year, the cut of approximately $1 trillion over the next 10 years to the federal Medicaid program, as well as to the expiration of the enhanced premium tax credits for folks on Access Health Connecticut, which hit January 1st. And we are looking at major threats to the stability of our hospitals in Connecticut, as well as a growth in the number of uninsured and underinsured people in the state, as well as responding to the governor's efforts to respond to that with temporary measures that he enacted earlier this year. And so I can go through a couple of the key provisions. It looks at responding to the potential expiration of Covered Connecticut. That is our safety net program that sort of stands between Medicaid and Access Health for our lowest income working people, and it suggests and starts the process for potentially converting it either in whole or in part to something called a basic health plan. And the reason for that is very simple. There is additional powers that the state has to withstand a hostile regulatory environment in Washington to create a somewhat similar program, potentially expand coverage from 175% of poverty up until 200% of poverty. We're also looking to sustain the governor's efforts in providing tax credits for folks who are purchasing private health insurance. He announced efforts to cap costs under 200% of poverty, as well as half the increase for folks between 400 and 500%. We're looking to go to 600% and fully make up the difference. We're planning on doing that by creating a health care affordability trust fund that will be capitalized by the Federal Emergency Response Fund that we set up last fall. We're looking to do more on addressing some issues that we heard from hospitals by providing them access to disproportionate share payments to ensure that those hospitals are compensated for and underinsured residents who present at the hospital. But rather than just give a blank check, we're saying we ask you to do more to address medical debt, ensuring that people are not balance billed if they are low income. In addition to that, we've heard from our hospital friends that they are often warehousing patients. People are stuck in the emergency room, and this is a critical issue. And so there are some changes to prior authorization requirements in the bill as well. I think a lot of the discussion, though, has been around a proposal the governor and the comptroller have presented around something they call the Connecticut option. I think all are in agreement that we are not ready to set this up on day one in Connecticut. The question is, how do we start the conversation and sort of figure out who needs to be at the table and what questions need to be answered before we can look at major market reforms in the healthcare space. And so this bill starts that conversation. It sets up a planning process. I'm expecting that process will be a moving target as the session moves on. And we're hoping we can at least start that conversation this session for implementation by the legislature in a future session. Urge members to adopt it. This will make health insurance more affordable for the middle class in the state. It will ensure that low-income residents don't lose their health care. It's a good bill, ought to pass.
Thank you, Senator Lesser. Senator Perillo.
Madam Chair, thank you. I'm probably going to have questions throughout this discussion. So you've always been very good about giving me some latitude and sort of coming in and out, but just sort of lay the groundwork for this discussion. You know, the Senate chair said something that I think is very, very important, that this bill is intended to address threats to hospital stability. But we need as a group to come to terms with the fact that the biggest threat to hospital stability here in Connecticut is the fact that a third of our residents are on Medicaid, and our Medicaid reimbursement rates are among the lowest in the country. And let me tell you why that is the cornerstone of our problem here when it comes to hospital affordability. All government insurance, and most particularly Medicaid, reimburse hospitals at a rate that isn't just lower than what they charge. They reimburse hospitals at a rate that is lower than what it actually costs to treat the patient. So, what is a hospital to do? The only way a hospital can cover the cost of care to those patients who are government funded, Medicare, Medicaid, where there's a deficit. Every single patient, it's not like, you know, oh, we lost $10 on that patient, but we'll make it up on volume. If you're losing money on every single patient, you can't make it up on volume. So the only way the hospital can be made whole is if commercial insurers pay higher reimbursement rates to cover that gap. That's the only way the hospital can do it. Now, what does that mean? That means that in order to pay those higher reimbursement rates, those health insurers must charge higher premiums. That is where the lack of affordability emerges, because the premiums paid by employers' employees must go up. They must go up again because our Medicaid rates are so low. So, and we heard that loud and clear from the hospitals. And we hear it quite honestly every year. And those of us who, I'm actually fairly new to the committee, but some who've served for a long time have heard this story again and again and again. Yet we don't do anything about it year after year after year. You know, I look at Senate Bill 3 here as a very complex, dangerous, and risky proposal to address a problem that could be much better addressed and much more simply addressed if we simply looked at our Medicaid reimbursement rates, sat down with the hospitals and said, okay, what do you need to flourish? I'm not saying walk home with hundreds of millions of dollars in profit. Our hospitals are largely nonprofit. I'm saying, what do you need to treat patients safely and effectively and provide them the access that they need? That's the conversation that needs to be had if we are actually going to address the issue of affordability here in Connecticut. But we're not having that conversation. What we're doing in Senate Bill 3 is driving, or at least intending to drive, more and more patients to government-run and or government-funded health insurance programs. Let's go back to where I started. The more patients in government programs with low reimbursement rates, the higher we drive up commercial premiums. So Senate Bill 3 actually exacerbates the problem that we are trying to solve. The more patients in government-funded plans and government-administered plans, the more patients in those plans, the higher premiums have to be for commercial insurance. That's the lack of affordability. That there is the affordability problem. And Senate Bill 3 just exacerbates it. I have a lot of questions, and I know they're going to come up. And always I appreciate the chair's indulgence in being able to hop in and out. But that is the groundwork around which we need to have this discussion. If we are truly going to be intellectually honest about a conversation about affordability. Thank you, Madam Chair.
Thank you, Senator. Representative Case.
Thank you, Madam Chair. And I think my good senator next to me who spelled out some points. And what I want to talk about is, from what we heard with the proposal on this bill, we're going to be talking about threats. What I want to talk about is what's happening now in Connecticut. We have two studies we spent $6 million on. We got $400 million in rate increases that haven't happened since 2001. Let's do things we know now. Let's not work about threats. $400 million. We are not reimbursing at a rate that we should be within the state. We can't even afford ECS for our schools. We're over $150 million behind where we should be, but we're going to worry about threats. We have problems in the state of monies we have not paid forward. You know what we do? We add taxes. We add fees. Every time we don't have money, we add taxes, we add fees. I'll say it 100 times on the House floor when it comes up. We want to make Connecticut affordable. We want people to afford to live here. Let's look what we're adding to the fees and to the taxes in their pocket. We have a fee, 1% on meals in the state of Connecticut for COVID to help restaurants with outdoor dining. Who in here is going to tell me that COVID is over? That we don't need that anymore? Why don't we get that 1% off of the prepared meals? That's when you buy a prepared chicken in the store, a grinder at the market, or if you go out to a restaurant. A lot of people don't know that 1% is on their bill. Let's worry about what we know. Guys, since 2001, I've been on this committee 14 years. We've talked about rates since I've been here. Last year was the first year we told $400 million we needed. We did 15 million of the 400. Let's do what we know now. We know we need 400 million. Why are we going to worry about funding threats that are coming when we can't even pay what we know we have to pay? Once we start increasing and getting our facilities, our dentists, our doctors, our PCAs, our home care health agents, the people who are the backbones of the state of Connecticut, the rate of reimbursement they deserve? You want to talk about the federal government? Low energy assistance. Anybody know we got 3% increase this year? The commissioner told us the other day we are flush with money in that account. Oh, but we're getting cut. We didn't get cut. We got more money. Let's talk about what we know now. Let's put the money where we have to do it. Everybody tells us. We had hearings the other night for hours. Rates, rates, rates. Don't worry about threats. Let's worry about what we got to do now. 2001, how many years is that? We haven't done a darn thing in this building for people with reimbursement rates. Let's do what we know. Thank you.
Thank you, Representative. Yes. Representative Meskers.
So I probably would disagree at some level with Senator Perillo in the reimbursement for hospitals, only to the extent that I'd be willing to see the reimbursement rate go up if I could get a concomitant commitment to see them reduce the rates for the private sector. I think fundamentally we are under reimbursing the hospitals, and I believe there is a transfer pricing risk. But if the state is giving them 50 cents and the private sector is getting $1, and I raise the rate to 75 for the state, do I get to pay 75, or are they going to keep me at $1? So I think when we look at the reimbursement rates, I think the hospitals need a higher Medicaid reimbursement rate. I'm hoping we can have accountability on the other side so that the self-insured market and the private market gets their reimbursement as well. And that's part of my concern with SB3 as it's presented so far. I have a couple of concerns which I'll try to outline right now. My first concern is that the plan, as I read it, looks to charge us with creating a working group who designs a plan that is then instructed by a different constitutional office to administer a healthcare plan with a $200 million trust fund. I don't know when the look back on a proposal versus a plan goes to the insurance committee, goes to the public health committee, and comes back to us in human services for a review on the costing structure of said plan. I don't know what that plan does in the way of reimbursements. And if Senator Perillo is right, and the concern is that the plan would give a lower reimbursement rate akin to Medicare, then we're going to increase the burden on the hospitals, and that will transfer ultimately to the private sector, the self-insured and individual plans, and Access Health, because all of us will be facing this pressure. I don't think there's any malintention in the plan. I think the idea of providing healthcare is essential. I would never have designed the plan we live in the United States of America. I do not understand that I can't price one medical procedure by calling up, getting on the phone, looking at what it's offered at, and shopping where I get the procedure done. I never get an incentive if I find a cheaper process. In my conversations in various committees, the lobbyists and people come to me and ask for parity in payment of services. And invariably, when I look at payment of parity of service, it's payment at the highest reimbursement rate on parity. So I've got a podiatrist and an orthopedic, or I've got an optometrist and an ophthalmologist, and everybody argues for parity. And when I go into the supermarket, I don't walk in and say, give me the most expensive gallon of milk, and I want to buy the cheapest, but please charge me the most expensive gallon of milk price. And this is part of the process of negotiation. If we are, and we're I don't know if that train has left the station in negotiating healthcare costs, but we're in a dilemma where if we're compounding at 7 to 10% a year, the Access Health Plan, I mean, I hear the deductibles are close to 10 or 15,000. Our plans are becoming catastrophic insurance. I look at some lobbyists will tell me, well, if you get rid of the mandates, you'll get me a lower cost of insurance. Well, I'll get a cut for 1 year, and then I'll compound at 8 or 10% with lower mandates. And maybe I don't cover insulin or don't cover other things that are priorities for many of the members of my, and I think both parties, for insulin and various procedures. We are on a trajectory that's complicated, but I think if I were to look to support a bill like this, it would require all the different parties at the table for the working group. It would require a proposal to come back to the committee and back to insurance and back to commerce, back to appropriations and bonding, revenue, and finance with a cost involved. And if the cost is, if the majority of the legislature wishes to support this cost, it should be supported by the general fund, which is a progressive form of taxation, not by assessments or not by laying off the cost on the rest of the private sector. Because if we don't grow our small businesses, if we don't grow our economy, we're not going to be able to pay for anything. So my concern is not that I'm vehemently opposed. I think the problem is a Connecticut option has to be looked at rationally and the process should not go to a separate constitutional office. It should be back with this legislature to figure out what it is, how we administer it, how we pay for it. And sending it to a third party is absolving us of the responsibility to make the choice. And using a trust fund to fund it begs the question of how will we fund it in outgoing years. So structurally, I have problems with it. I don't think the intent is malicious. I think the intent is a robust conversation of affordable health care. But I'm waiting for a proposal that makes me believe that affordable health care is in sight. When I looked at the state plans, we have municipal plans, we have the employee plans. They're compounding at 7 to 10% a year. I don't know who on earth thinks a 7 to 10% compound rate on a healthcare plan is reasonable. It's going to double and triple our healthcare costs in 7 years. So I expect that there's enough support that the bill will come out of committee and be supported, but I want to flag it for those concerns, and I'd like to see some of those issues addressed. And I want to thank the chairs for their effort. I understand there was a lot of good work put behind it. Thank you.
Thank you, Representative. Any further questions or conversation? Senator Perillo.
Madam Chair, thank you. There are a lot of different programs suggested in this bill, some of which, at least in my eyes, and maybe I don't understand it well, seem to be working at cross purposes. So I'd kind of like to understand, especially when it comes to state plans. I mean, we've seen in the partnership plan, we're losing money there. That's a problem. And I see in this bill things that kind of remind me of that. So it worries me. And I'm wondering, because we do have Access Health Connecticut, which is our exchange. And as we introduce, or at least contemplate the introduction of this Connecticut option, as we introduce or consider the introduction of a basic health program, I want to understand how all of those would work together. So can I get a bit of an understanding of what is envisioned with the basic health program?
Yes, through you to Senator Lesser.
Yes, thank you. Thank you, Madam Chair, and through you to the gentleman 2 seats to my right. I want to just say that the basic health plan is going to be somewhat similar to covered Connecticut. This was a option established under 1331 of the Affordable Care Act, and it simply provides for a plan that would cover folks up to 200% of poverty. The state would administer the plan and would contract with a risk-bearing entity. So that is either an MCO or an insurance company to administer that. We would be handed 95% of the advanced premium tax credits that all individuals who make under 200% of poverty would be entitled to if they were all enrolled on an Access Health plan. And then we would have flexibility in terms of administering it. So the purpose of that would be to create a program somewhat similar to Covered Connecticut, but because we wouldn't need to go to the federal government for waiver approval, we feel confident that that will survive whatever comes our way from Washington.
Senator Perillo.
Really annoying. So thank you, Senator. I appreciate that. You mentioned risk bearing, and I want to make sure I understand the context. So with the basic health program, I understand it would probably be administered, at least what we think is what would happen would be administered by a third party insurance company. But who would bear the risk?
Senator Lesser.
Yeah, so that would be an insurance company.
Senator Perillo.
Oh, okay, so okay. Then maybe I don't understand. So what does the 95% from the federal government pay for?
Senator Lesser.
Right. So the 95% will pay for the cost of the care that the population enrolled in the basic health plan. Yeah, it's the funding, but there is the involvement of a risk bearing entity.
Senator Perillo.
Thank you, Madam Chair. So what is then the role of the state of Connecticut in a basic health program? You're saying that we're able to, we access federal funds at like 95%, sounds good. And then we're contracting with an insurer to bear the risk. So what happens if actual experience is higher than anticipated and the actual cost of paying for care is higher than the premiums?
Senator Lesser.
So obviously that will be up to the specific contractual provisions and the specific design of the program, which are important questions that need to be worked out. There could, of course, as with any program, if there are cost overruns, that could impact the state or the provider, depending on the contractual terms, but that is a big issue. What I will say is that we're not the first state to look at this, and our neighboring state of New York has a basic health plan and has for years. And one of the things that they've experienced is actual record surpluses, that they have a very healthy fund. It's another trust fund, but a trust fund that funds the basic health plan, and that they've been continuously in the black since its inception.
Senator Perillo.
Thank you, Madam Chair. So as I read the language of the bill, and it's a lengthy bill, as you know, it's almost implied to me that the basic health program would be very closely affiliated with, coordinated with, call it what you want, Medicaid, which of course is administered by the state of Connecticut. We know that. So is the intent here in SB 3 that the basic health program would not be administered through the state of Connecticut? They would most certainly be administered by a third party that would also bear the risk?
Senator Lesser.
Yes, that's a requirement of federal law.
Senator Perillo.
Okay, so, okay. Then sort of my next question, and again, as we run into this sort of web of different options, I'm wondering how the basic health program would integrate with, perhaps even conflict with, what Access Health offers. How do they work together?
Senator Lesser.
That is a really important question that needs to be ironed out, and I understand there's analysis of that happening right now. But right now we have something called Covered Connecticut, and the Covered Connecticut is a Medicaid veneer that like hangs over a basic over an Access Health chassis. It is if I'm mixing metaphors, forgive me, but it's a hybrid of those two programs for low income folks who fall between, fall in the crack. And so this would be potentially replacing that, or standing side by side with Covered Connecticut as we look to the future of the Covered Connecticut program. And Covered Connecticut has been an unqualified success. About 50,000 Connecticut residents get their healthcare this way. It's worked well, and it's brought in extra federal funds. I understand that our friends in the insurance industry like it too. It seems to work well for a lot of folks. The problem is that we received a waiver to set it up under the Biden administration. That waiver is coming due next year. We're going to need to re-up it. And a lot of folks who watch CMS more closely than I do have expressed concerns about the likelihood that the Trump administration will reauthorize the Covered Connecticut waiver. And so the question that we're trying to figure out, as we're seeing all sorts of things coming down to us from Washington, is what do we do? There is a potential that waiver will be extended. I don't have a crystal ball, but the folks who are looking at this say, well, that maybe the best thing to do would be to leave well enough alone. But if that's not a possibility, then we need to find some sort of replacement product, and a basic health plan seems like a step forward.
Senator Perillo.
Thank you, Madam Chair. I appreciate that. And of course, I appreciate the gentleman's answer to my question. And again, this becomes complex because we've got so many different programs that exist right now, let alone the ones that are suggested in the bill that's before us. So I want to kind of understand. The gentleman referenced Covered Connecticut and the success in that, and that it has made care affordable to more individuals, which is great. We have, of course, the exchange right now, which is sort of how I get here. One of my concerns, not just with the exchange, but certainly with SB 3, is an expansion of the pool of eligible residents to participate in a government-run program, health insurance program. Because back to my initial point, let's talk about Medicare, because I think a lot of people would say Medicare works. A lot of people are insured, they get care under it, it's fantastic. But again, let's look at why it works. Medicare works because it pays hospitals less than the cost of providing care. And again, the more people and the hospital stays open because of the commercial payers, we already covered that. The more people we put into this alphabet soup of government-run health insurance programs, the more people we put into this program and that program and this one in Section 4 and this one in Section 8, the more we do that, the more threatened hospitals become, and the fewer commercial payers there are out there to bridge the gap. So then what happens? We start having to make decisions about whether or not we're going to support our hospitals. When you continue to under-reimburse, and by the way, there is nothing in this bill to suggest to me that we're going to begin reimbursing hospitals appropriately. There's nothing in this bill that suggests that. So if we're going to stick with the status quo, and we're going to continue to under-reimburse hospitals with the plans that have been laid out here in this bill, then let's play that out. What's that end game start to look like? You start to have an access problem, right? Because you can only have so many providers if they all get under reimbursed. And once you have an access problem, then you want to talk about hearing complaints. But shifting gears when we talk to access, let's talk about, if you don't mind, the Connecticut option. And I appreciate the senator saying that perhaps that might not be ready for prime time. I would agree. But I think we need to understand what we're getting into, and we at least have to have some sort of understanding of what we're studying in this work group. So how is it expected that the Connecticut option would actually be an affordable alternative? What's the mechanism by which we get to affordability?
Senator Lesser.
Yes, thank you, Madam Chair. And through you to the honorable ranking member. First, I do want to respond to something that the gentleman said earlier a couple of times, which is that there is no, he points out correctly that our Medicaid rates in the state are not adequate. We are not adequately compensating providers. I will point to a couple of challenges. One, the HR 1 that was passed and signed into law on July 4th last year severely limits our ability to compensate hospitals. It puts an upper payment limit that is a real existential threat to our higher hospital landscape. And the gentleman's correct that we gotta do more, but we have to get creative about how to compensate providers. And I will point him to Section 11 of this bill, which references disproportionate share payments to hospitals. Far from what he said, this is actually an effort to adequately compensate hospitals, to direct more resources to them, and to do one in a way that was not targeted by HR 1, which is these dish payments that the state has not accessed. My understanding is from talking to OFA that we're eligible to access up to $400 million in additional dish pay, or sorry, $300 million. We currently we currently use about $100 million, so total of about $400 million in dish payments that we're potentially able to access. And this is one of the key ways identified by Connecticut hospitals that we can direct more resources to them to help ensure that they're under an adequate financial footing. So, I want to make sure that anyone who's following at home or watching this bill closely understands that we all agree on the need to make sure that we've got an adequate access to hospitals in the state. It's something that is important to any legislator and anybody in the state that you can go to an emergency room if you're sick. Second of all, in terms of the gentleman's question about what could the Connecticut option do to bring down the cost of coverage, that's a question better asked of the comptroller and the governor who've presented it. I'm not going to be hold myself out as an expert. They've talked about a variety of market reforms that they're interested in pursuing, things like capping hospital reimbursement rates for plan participants. I've heard about narrow networks. I've heard about reinsurance. Those are all things that we need to study. I'm not asking folks to endorse those, but what they're looking to do is put together a plan that they can present to us. I will say that nothing in this bill commits anybody in this General Assembly to any of those ideas, because all of those would require changes of the general statutes, and nothing in this bill waives a single law that would otherwise have to be addressed by a future legislative session. So, we need to start the conversation now, I think. But then we will invite them to come to the table, come to us with a proposal that we can say yes or no to, if we like it or not like it. But all of those efforts are designed to make sure that healthcare is more affordable for the people of the state. And I think that's an important conversation.
Thank you. Senator Perlow.
Thank you, and I appreciate that. I can respect and appreciate the irony of how that was just framed, in that this is good for hospitals, and the dish payment was referenced, and I support that component of this, to be honest with you. But I find it ironic, though, that the Connecticut Hospital Association is opposed to this bill. So to suggest that this is good for hospitals, one would think this Connecticut Hospital Association would agree, but they don't. So that makes me a little bit wary. It makes me a little bit concerned. And I don't think, and with all due respect, I don't think we can punt the question on how the Connecticut option is going to become affordable. I mean, there was just a press conference out here this morning saying how affordable it's going to be. Every senator in the building in the Democratic caucus is a co-sponsor on this bill. So we got to have some sense of how the heck it's going to make things affordable. But here's what I remember the governor saying in his opening remarks about the Connecticut option. Because let's understand what we're talking about here. The words matter. The governor said, I'm paraphrasing, that we would be able to save money, but we would be able to make things more affordable by driving patients to specific hospitals labeled as, by the governor, as lower cost hospitals. Now let's translate that. That's Yukon and Waterbury and hospitals basically owned by the state of Connecticut. Now, the irony is that there's actually not lower cost hospitals. Yukon is an example of a hospital that has a very robust pension system, is very highly reimbursed, and that quite honestly loses money all the time. And it just acquired Waterbury Hospital, which has been losing money for years. So let's understand exactly what we're doing here. And I mentioned the word risk in my opening remarks, and I'm going to come back to them now. We already have government programs, some of which lose money, others of which are extraordinarily expensive, and all of which we pay for as taxpayers. And the bill before us expands that list of government programs. And our track record is not that great when it comes to this. So it is very concerning to me that rather than do, sometimes the easy, what is it? Is it Occam's razor? Sometimes the most obvious answer is the answer. Don't quote me on that. I think I'm wrong. But sometimes the easiest solution is the solution we ought to pursue. And I'm no genius, but I understand that commercial premiums are high because Medicaid reimbursement is low. Therefore, if we just sit here, and by the way, we can work with the Appropriations Committee to do this. We are the Human Services Committee. If we would just stand up and say, okay, let's raise Medicaid reimbursement rates and see what that does for affordability. That is an easier solution. It is a much more easily understood solution. And it is one over which we have some control and some degree of certainty. We have no control, no degree of certainty over the programs offered in Senate Bill 3. I would much rather see us start at the easy solution, which is increasing Medicaid rates, rather than introduce a very long, very complicated bill that creates a lot of potentially very large and very risky government-run plans, many of which at taxpayer expense. So, I mean, it was sort of a circular argument here with the senator, and that's fine. We do that all the time, he and I. But I'm just very concerned here that we are putting out a candle with a fire hose and not even really knowing where we're pointing it. I just see tremendous risk here. There are easier ways to address this, ones that are far less risky. And we're really not doing that. Outside, and the gentleman's right, outside the dish payment section of this bill, we're really not addressing reimbursement to hospitals at all. And all we're doing is moving more people to a government-run health insurance plan, which historically have under-reimbursed providers and historically have driven up commercial premiums. That's where we are. I can't possibly support this. I would love. Somebody asked me today, well, what could we change? What could be removed from this bill to make you support it? Nothing. There's no little thing you can do to this bill to make it appealing. You can start from zero and we can work as a group and come up with solutions that are safer, that make more sense. We could do that, but you can't do that by changing a couple sections of a 36-page bill. So those are my thoughts. Thank you, Madam Chair.
Thank you, Senator. Any further conversation or questions? Representative Johnson.
Thank you so much. I just wanted to add a few remarks about this. I think it's a very good bill. I think it will help us explore some of the issues that are raised by Senator Perillo. One thing that was mentioned was the Medicare program. You have a cost medical ratio with Medicare fee-for-service program that's 5%. With the regular private entities, it's 20%. So when you look at the fee-for-service ratios, that's one of the things that allows the private sector to increase things and pay for things, whereas the public sector actually doesn't cost as much because the fee-for-service medical ratios are so much lower. So one of the ways that this could be addressed through the public sector is because of the way that the the ratios looked at. The other thing is mentioning the Yukon Medical, the patient mix. Patient mix there is much higher Medicaid. So when you have a patient mix, it's a much higher Medicaid. As you just got through saying, the Medicaid reimbursement's too low. And so when you look at how much money they make, well, that's because the patient mix doesn't equate to other places that have a patient mix that includes private insurance. Another idea that we want to take a look at when you mentioned the Waterbury, but I would also include Manchester and the places that were in Rockville that were gobbled up by private equity that destroyed them. They were still charging more because they were having more of a patient mix with private insurers, yet private equity came in and took over so much of what they had. So that's why we have now an interesting combination of not exactly Yukon or the state taking the whole thing, but a mix of a combination of a program where we have the nonprofit mixed with the public in this particular circumstance where you have Yukon being the public, but then Waterbury, Day Kimball, and Bristol being part of the new mix, which should be very interesting in terms of analyzing the view that we have as things are funded. So they will be renegotiating things with the insurance industry that will create a new look at pricing and patient mix. And then finally, something I would love to do in this group is I would like to take what was eliminated in the 1990s called the Hill-Burton Act, which provided money to the hospitals. In return, they gave free care as long as the hospital was in a situation where they were able to, and they needed some type of help with renovations. So they could get the renovation money from the feds, and then the feds would say, okay, hospital, you have to pick and choose which patients are going to get the free care. That was repealed in the late 1990s, which I was very disappointed to see that happen. And it was put into effect, by the way, in the 40s during World War II to help offset the cost of people working for lower wages because they couldn't afford to increase the cost. So that's how we got the split. And I'm going to 2MI. Anyway, I think that this is excellent. It'll give us a chance to explore some of these issues. And I think that we need to take a look at the systems. And I'm really happy to see Senate Bill 3. Thank you.
Thank you, Representative. Any further conversation or questions? Senator Perillo.
I'm sorry. I have another question. And thank you, by the way. One of the things I mentioned before, and I think that we all agree on, is there are a lot of different options in here. This is a bill with a lot going on. We've talked about that, and I've kind of banged away at that a bit. But one option I don't see in here is association health plans. And I'm wondering why that has been left out as an option through you,
Senator Lesser.
I think that legislation is being handled by the Insurance and Real Estate Committee.
Thank you. Senator Perillo.
So would the gentleman say that issues related to insurance ought to be handled by the Insurance Committee? Because this is a bill about insurance.
Senator Lesser.
The biggest part of the bill is about a healthcare affordability trust fund, and that does involve insurance. It also involves Medicaid, and as I mentioned, Covered Connecticut straddles the difference, and a basic health plan would as well. We received bills this year that straddle committee cognizance, and where the bill goes after that, after it leaves here, is above my pay grade. But many issues straddle multiple committees. But my understanding is that the Insurance and Real Estate Committee, which I serve on, is they're focused on the association health plan model. I'm happy to talk about it because I know a little bit about it because I serve on that committee. But that's not a part of the SDO caucus's proposal. Through you.
Thank you. Senator Perillo.
Thank you, Madam Chair. And I can appreciate that. Every bill has a home. But what worries me is that, again, we are the Human Services Committee. We deal in state-run, state-administered, in most cases, state-funded insurance products. And this bill is before us. This bill is before us. So again, it leads me to the concern and my concern that this is just leading us toward an expansion of government-run, government-funded insurance plans that weakens the private market, and the fact that we're not addressing private sector options. And I can appreciate that other committees may be, but I think we're a little concerned that we're just not looking at this in a very holistic way. And I almost sort of the cynic in me kind of wonders, hey, are we just really, at the end of the day, just trying to drive everybody to a single payer model? That's kind of my worry, because I kind of feel that, and I feel it every year. And this just sort of is reminiscent of that.
Thank you, Senator. Any further questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF to the floor, Senate Bill 3. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case. Senator Perillo. Representative Comey.
Yes.
Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Could you please turn on your camera? Thank you.
Yes. Representative Butler votes yes.
Thank you. Representative Dathan.
Yes.
Representative D'Amico. Senator Gaston.
Senator Gaston votes yes.
Representative Fortier.
Yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
No.
Representative Meskers.
No.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake. Representative Stewart.
Stewart's yes.
Representative Vale.
No.
The roll call is now complete.
Thank you, Madam Clerk. We will hold the votes open. Next, we will move to number 44 on the agenda, House Bill 5041, an act expanding healthcare coverage. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second?
Second.
Moved by Senator Lesser, seconded by Representative Comey. Any discussion? Senator Lesser.
This is the governor's healthcare package. It came to us. It contains a variety of different proposals and would urge members to support it.
Thank you, Senator Lesser. I agree. Any additional questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5041. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case. Senator Perillo. Representative Comey.
Yes.
Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan. Representative D'Amico. Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes. I'm sorry.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
No.
Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
Rep Pizzuto, no.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake. Representative Stewart.
Stewart, no.
Representative Vale.
No.
The roll call is now complete.
Thank you, Madam Clerk. We will hold the votes open. Next, moving to number 12 on the agenda, House Bill 5482, an act concerning 12-month coverage for contraception and hormone therapy. This is a JF to the floor. Do I have a motion? Is there a second? Moved by Senator Lesser, seconded by Representative Kitt. This bill brings some equity between our current state law, which allows 12 months coverage for contraception in private insurance, to the Medicaid program, and expands coverage for hormone therapy to 12 months in both private and in Medicaid. Any conversation or questions? All right, seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5482. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case. Senator Perillo. Representative Comey.
Yes.
Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico. Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Could you repeat that on camera, please?
Representative Hughes votes yes.
I saw you enough. It counts. All right. Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake. Representative Stewart.
No.
Representative Vale.
No.
Is there any who did not vote that now wish to vote?
Senator Perillo votes no.
All right, the roll call is now complete.
Thank you, Madam Clerk. We will hold the votes open. Now moving to number 14 on the agenda, House Bill 5483, an act concerning fertility care under the Medicaid program. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Comey. Any conversation or questions? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5483. Representative Gilchrist.
Yes.
Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan. Representative D'Amico. Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake. Representative Stewart.
No.
And Representative Vale.
No.
Are there any that did not vote that now wish to? The roll call is complete.
Thank you, Madam Clerk. Again, we will hold the votes open. Moving to number 35 on the agenda, Senate Bill 497, an act protecting food security for veterans and others and mitigating federal cuts to nutritional assistance. This is a JF to the floor. Do I have a motion? Is there a second? Moved by Senator Lesser, seconded by Representative Comey. Any conversation or questions? Senator Perlow.
Madam Chair, thank you. Again, there's a lot in here, so I just want to understand for my benefit and benefit of everybody, perhaps. There's a lot of money in here. This is a transfer of $40 million. What exactly, why do we need to make this transfer? What has changed such that the 40 million transfer is needed?
Senator Lesser.
Yes, thank you, Madam Chair, and through you to the honorable ranking member. The bill is designed to address another piece of HR 1, the so-called Big Beautiful Bill that passed last year, that sharply limits access to SNAP. That's our food assistance program for low-income residents. The bill affects Connecticut in a number of ways. It is an unfunded mandate that requires us to simply pick up $40 million of the cost of administering the program. It also commands Connecticut to lower our error rate in administering the program or else face a $140 million penalty. And then thirdly, it restricts access to the program in a variety of ways, including removing exemptions to existing SNAP work requirements. And so this bill is designed to provide transitional support to folks on the SNAP program so that folks don't go hungry. And we're focusing on time-limited and temporary bridge program to ensure that if you are in one of the affected towns, because towns that have high unemployment rates were exempt, now they are not, that you're able to get a transitional benefit. We're also identifying vulnerable persons who are particular priorities and making sure that they get additional food support. So those include returning veterans. We have American servicemen and women right now in harm's way in the Middle East. And when folks come back, they may be disabled, but under federal law, I believe, have to be permanently disabled to qualify for an exemption to the SNAP work requirement. Obviously, if you're 80% disabled, you've gone through a lot in service of this country, and yet under the rules of HR 1, you have to have a job. In order to qualify, you can't just be income. You cannot just be qualified by low income. So what we're saying is, for those extremely worthy folks, for people who are survivors of domestic violence, human trafficking, for kids aging out of foster care, we're classifying you as vulnerable persons and saying the state has a vested interest in ensuring that you get the food that you need. There are a lot of reasons, and particularly we heard a lot of folks from the veterans communities talk about how critically important a bridge program like this is, hoping we'll move it forward. And in terms of how we're funding it, we're tapping, again, the federal cuts emergency response fund created to provide that bridge funding through you.
Thank you, Senator. Senator Perlow.
Madam Chair, thank you. I appreciate it. And I appreciate the gentleman's answer to that question. I'm looking at Section 7, and it doesn't necessarily align with other things that are in this bill, but it references individuals on parole or who have a probation violation. Could the gentleman sort of walk me through what Section 7 does through you, Madam Chair?
Senator Lesser.
Yes, my understanding is that federal law has a requirement that if you are on parole or probation, that you are in compliance with the conditions of your parole or probation in order to qualify for SNAP. Fine, that's the law and it's a good policy. The issue is that the Connecticut SNAP admission form also asks for the compliance status of other people in your household. And the concern is that we're collaterally punishing someone for being related to someone who's committed a crime. There's no federal reason why we need to do that. I think this stems from a misread of the federal regs. And so we're simply conforming the SNAP application process to federal law.
Thank you, Senator. Senator Perlow.
Thank you, Madam Chair. But I'm not sure I agree with that characterization. I would imagine that the language is as it is and the forms are as they are because there's an obvious risk that our SNAP benefits could be supporting someone who is in violation of their parole or probation, even though they're not necessarily the applicant, right? You could have a spouse be an applicant and the individual who's violated their parole could benefit from the SNAP benefits. So I get it. I understand what the gentleman's saying, but at the same time, there's a reason why the form says what it says now. And it's to make sure that the federal guidelines the federal laws are followed when it comes to individuals who have violated their parole or probation receiving benefits. So I get it, but at the same time, I don't. Thank you, Madam Chair.
Thank you, Senator. Any additional questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF Senate Bill 497. Representative Gilchrist.
Yes.
Senator Lesser.
Yeah.
Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico. Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Oh, I saw you. There we go. Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Master
Yeah,
Francesco.
Your picture's there.
I know, but I can't find the thing on the bottom to unmute, so I move it over and then they can't see me.
Self-imposed. Yeah.
Representative Master Francesco. No. Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake. Representative Stewart.
No.
Representative Vale.
No.
The roll call is now complete.
Thank you, Madam Clerk. We will hold the votes open. Okay. All right, moving on to number 1 on the agenda, House Bill 5358, an act concerning the rebasing of rates of reimbursement for certain residential facilities. This is a JFS to the floor, LCO number 3431. Do I have a motion?
So moved.
Is moved by Senator Lesser, seconded by Representative Case. Any questions or conversation? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JFS House Bill 5358. Representative Gilchrist.
Yes.
Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan. Representative D'Amico. Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit. Representative Master Francesco.
No.
Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes yes.
Representative Shake. Representative Stewart.
Yes.
Representative Vale.
Yes.
The roll call is now complete.
Thank you, Madam Clerk. We are now going to move to number 5 on the agenda, House Bill 5356, An act concerning non-emergency medical transportation. This is a JF to the floor. Do I have a motion?
I'll move.
Is there a second? Moved by Senator Lesser, seconded by Representative Comey. Any conversation or discussion? Representative Case.
Thank you, Madam Chair. This one comes to us quite often. I know I'm at the same place that I have been. We have a contract. I want to follow the contract. There's liability. I want to follow the liability. Nobody's proven yet that there is no liability with outside, with the F endorsement in the way it's working. I like it. We need to get more drivers. I think that we need to sign off from DSS and MTM that this is okay with their contract. I still haven't seen language as that comes forward to us. There's been a hard lobbying part out there to make sure that we get the F endorsement and have it the way it wants to happen. But I think there's a contract out there. There'll be a few bills today that have contracts that we have to stay forward. They're negotiated. And I think MTM has the ability to do what they need to do. Thank you.
Thank you, Representative. This is a work in progress and has been a work in progress for a few years. I think the goal for all of us is to ensure that anyone using non-emergency medical transportation is safe as possible. And so we're trying to figure out a way to do that and ensure that there's kind of equality between delivery drivers and the Uber Lyft drivers. So hope to continue that conversation with you and others to ensure we can get to a good place this year. Representative Vale.
Madam Chair, thank you. I was going to vote yes for this until you just called it a work in progress. Is this, I'm voting on, is this a work in progress or I'm voting on what's in front of me right now. And I had an F endorsement. I don't think it's necessary. That's why I was going to support this, but I'm going to vote, I'm still going to vote yes, but you make me nervous. I don't like that work in progress part because I believe we're supposed to finish the bread here, baking the bread, and then we can debate it more on the House floor or Senate floor. But I will still vote yes, but you give me a little bit of pause, Senator.
Glad I didn't give you a full pause. Senator Lesser.
Thank you, Madam Chair. I'm with Representative Vale. This exact language passed the state Senate 36-0 last year. We're good to go, but we'll see whatever the House cooks up. It's up to you guys.
Representative Meskers.
So in caucus, I just made reference, and I want to make sure that the relevant authorities are looking not just at the licensing, and I hope we finish whatever concerns might, and I'm intending to support the bill, but I want a more robust report back at some point on the insurance liability of various carriers. Being on the insurance committee, now we're talking about 3 sets of people carrying our most vulnerable on the way to the hospital. I hope I don't have a $5,000 or $10,000 TL taxi and limousine commission insurance policy on that transport. So I want to make sure we've got the right liability insurance. And I may make that more as a public comment, not to burden our committee, but to make sure that that's part of the record, that they need to review the liability coverage of all of those parties. But thank you.
Thank you, Representative. Yes, Representative Pizzuto.
Thank you, Madam Chair. Just quickly, I agree with kind of both sides of the aisle, but my main concern is that DOT and DSS oppose this. And I think DOT does this, they do their due diligence when they get into this. So for that reason, I'd have to vote no on this. Thank you. Yep.
Thank you, Representative. Any further questions or comments? Representative Case.
Thank you. And I do appreciate the chair saying that it's a work in progress. For the point is, it's been a work in progress for many years. And it comes down to the last day of the session, and we still don't have an agreement or language that makes both chambers work. So I'm hoping that, I'll flag it with a no today for the reason I worked on it all last year, right up until the last day. But we can't get an agreement in both chambers on how this moves forward. And like we've been working with DSS, DOT, when we have a contract in place, we need to make sure that the person that has the contract is covered. But thank you, and we'll keep going.
Thank you very much. Seeing no further questions or comments, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5356. Representative Gilchrist.
Yes.
Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan. Representative D'Amico. Representative Fortier.
Yes.
Senator Gaston. Senator Gaston.
Senator Gaston votes yes.
Could you repeat that, please?
Senator Gaston votes yes.
Thank you. Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
No.
Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes yes.
Representative Shake. Representative Stewart.
Yes.
Representative Vale.
Yes.
Representative Dathan. Yes. The roll call is now complete.
Thank you, Madam Clerk. Moving to number 8 on the agenda, Senate Bill number 328, an act requiring nursing homes to spend 80% of revenue on direct patient care. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Johnson. Any questions or comments? Yes, Senator Perillo.
Thank you, Madam Chair. I appreciate it. I want to understand what this bill does. You read the title and you say, oh, that makes perfect sense. But I'm not sure that it does, because, right now, as I understand it, as I know for a fact, our nursing homes submit Medicaid cost reports to the state of Connecticut. And in fact, once upon a time in my life, I actually audited those when I worked in public accounting. So I know that they're quite detailed, and that DSS is very, very stringent about what costs are allowed and not allowed. They pay very close attention to that. And I've seen nursing homes that were audited and it wasn't pretty. So I'm just wondering how this bill relates to that and the already established rules under which nursing homes can spend their Medicaid reimbursement. So if somebody could sort of clarify how the two come together, that would be helpful.
Thank you, Senator. Senator Lesser.
Thank you. That's actually spelled out in the bill in lines 162 to 179. And it spells out, what specific costs they're allowed to consider and which aren't, how to handle capital improvement projects and fair rent increases. So it is a change, and we'll ask the Commissioner of Social Services to oversee that. And obviously, this also interplays with our current acuity-based methodology for reimbursing nursing homes.
Thank you, Senator. Senator Perillo.
Thank you, Madam Chair. I appreciate that. Yeah, I don't know if lines 162 to 179 do that. They're all new language, so they don't change anything that's already in statute, and they don't change any of the things that DSS already does to ensure that nursing homes are spending Medicaid funds appropriately. It just adds a new requirement. And again, if I'm missing something in this bill that addresses my concern, by all means, please point it to me. I just don't see it.
Thank you, Senator. Senator Lesser.
Well, we already have, through the cost reporting that the gentleman referenced through you, robust understanding of what it is nursing homes spend money on and how they spend it. But this is a requirement that they spend not less, they can spend more than 80% of their revenue on direct patient care.
Thank you. Senator Perillo.
Thank you, Madam Chair. I appreciate that. It's funny. I've voted yes today on a lot of bills that DSS opposed. So that doesn't necessarily stop me from voting yes. That said, though, DSS very specifically opposed this bill, stating, and they said in part, Medicaid reimbursement includes 5 allowable costs. And the bill itself, as is here, only leaves 20% for other critical services like laundry, social work, recreation, dietary, housekeeping. In this case, I actually agree with DSS. The direct care as defined in the bill does not really adequately represent all the services that are delivered to residents of nursing homes. So, again, while I understand and appreciate, and actually in many ways support what the bill is trying to do, I don't think that it does that. And that's my concern. I'm going to not support the bill today. I wish there were a way to make this work that made sense. I just don't think this does it. But maybe I can be convinced otherwise later on, but I don't see how I can support this today. Thank you, Madam Chair.
Thank you, Senator. Any additional? Yes, Representative Meskers.
So I will take the diametrically opposed position and support the bill with the same conditionality. As we've sat through a number of meetings in insurance, et cetera, the specter of private equity, the specter of investments in whether it be in home health care or in the nursing home industry gives rise to concerns that the dollars awarded by the federal government or the state are not going in the appropriate level to the intended beneficiaries. And I am deeply concerned that people in the last stages of their life are treated with the appropriate dignity and respect. So I think I understand the intent of the bill. So we may need to change the definitionals in terms of what the accepted care, because certainly social services and a support for our elderly is part of, I think, the fundamental care and rights they have. So I do want to see maybe a broadening of the 80%. I'd also I'll make the same request I'll probably make later as to when certificates of need are issued by the state, that there's an advisory work as to where the assets of the underlying facility are, because if the state is supporting facilities, whether they're hospitals or nursing homes, on Medicaid reimbursement, I would prefer not to see the assets stripped and sold away and have places go bankrupt and left back as wards of the state after we've dedicated 20 years of payments and support. So I'd love to see, two things over time. And I don't think we include both in this bill, but, for the agencies of the state, we need to make sure that assets don't disappear. It's the third parties. And we need to make sure that the loving, tender care we want for our vulnerable residents and I think this bill intends, and I think Senator Perillo and I will agree on how we make it happen. And it's, so I will tend to support the bill, and thank you.
Thank you very much. Senator Perillo.
I also think that Meskers and I would agree that if we increased Medicaid rates, we might avoid some of these challenges and everybody be helped safe.
Provided they went to the people, Senator.
Thank you. No further questions or comments? Madam Clerk, please call the roll.
A motion has been made and seconded to JF Senate Bill 328. Representative Gilchrist.
Yes.
Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson. Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco. No. Representative Meskers.
Meskers votes yes.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake. Representative Stewart.
No.
Representative Vale.
No.
The roll call is now complete.
Thank you, Madam Clerk. As a reminder, we will keep the votes open. We are now moving to number 10 on the agenda, Senate Bill number 326, an act concerning Husky C asset limits. This is a JFS to the floor, LCO 3457. Do I have a motion? Is there a second?
Second.
Moved by Representative Kit, seconded by Representative Dathan. Any conversation or questions? Representative Case.
Thank you, Madam Chair. And this does come to us many years in a row. Through you, S language came through this morning. Can somebody explain the S language for me? Is it just to move it out to 2028 because we don't want a fiscal note for 2026, 2027? Through you?
The S language does push out the asset test phase out to start in fiscal 28, and it requires DSS to report to the Human Services Committee on asset data for those found ineligible. No, it's more so about giving time because to do it all at once costs so much, but the policy is so important. And as you mentioned, we keep getting this brought to us. And so we want to find a way to be able to get there.
So through you, by pushing out to 2028, we will not get a cost from appropriations. Is that correct?
That is correct. Senator Lesser.
I also want to emphasize there was a data reporting piece. This is an issue that we've been trying to do for a number of years, including in 5001 a few years ago. The stumbling block in terms of getting accurate information from our fiscal analysts in terms of what the cost for the state for an expansion is, that's been a major hurdle. And so our hope is that this extra data that we're requesting from the DSS will give us, and particularly OFA, the tools to get an accurate fiscal note, which has been the major stumbling block, the reason why we haven't moved forward with this policy in the past.
Thank you, Senator Lesser. Representative Case.
Thank you. And I thank you for that answer. I think we really need to concentrate on what we know now of not increasing things for over 15, 16 years. If we can't get the right reimbursement rates now, we're putting more things on the books, but we're not putting it on now because we don't want a fiscal note because we're going to wait till 2028. We have enough to do right now. Let's get our rates where they need to be. Let's put the money where it needs to go. We have the studies done. Let's get people paid. Thank you.
Thank you, Representative. Any further questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JFS Senate Bill 326. Representative Gilchrist.
Yes.
Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar.
Sorry, Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes, but with a caveat, my dad's listening. He says my name is Gaston. So Senator Gaston votes yes. Thanks.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson. Representative Kit.
Representative Kit votes yes.
Representative Master Francesco. Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
Pizzuto votes no.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake. Representative Stewart.
Stewart votes no.
Representative Vale. The roll call is complete.
Thank you, Madam Clerk. Now we are moving on to number 15 on the agenda, House Bill 5485, an act concerning supported decision-making. This is a JF to the floor. Do I have a motion?
So moved.
Second.
Moved by Representative Dathan, seconded by Senator Lesser. Any discussion or conversation? Representative Dathan.
Sorry, I don't want to go on, but I'm very, very happy that the Human Services chairs decided to make this a bill this year to prioritize this for our community. This is something that I've been working on with my good ranking member since 2023. And I think, working with the advocates, working with the different people within the probate system and around our state, I think we have a very good bill that a lot of people are going to be able to utilize and feel comfortable about using in our state. So I just wanted to say that. Thank you so much, Madam Chair.
Thank you, Representative. And I want to thank you and the good ranking member for bringing this to us. Such compelling testimony, and really happy we're working on this. Representative Case.
Wasn't going to speak on this, but this is something that we've been working on since 5001, back a few years ago. I'm not fully sold on the whole concept for the reason I think others have to weigh in on it. There's been a lot of conversations and a lot of meetings. Decision making is very important to the population we're working with. And I want to make sure that things go forward. I will support this to get out. I want to continue those conversations and make sure that we have something that comes to a solid vote. We have a solid bill and that everybody can get behind it and make sure that supported decision making is something that this state wraps their arms around. I know there's some technical things that we have to get through, but I do agree with my good partner over there from the IDD arena that there's been a lot of work on it and we're getting there. So thank you. Thank you, Madam Chair.
Thank you, Representative. Any additional questions or comments? Yes, Representative Master Francesca.
Thank you, Madam Chairman. I just wanted to, and I'm sorry, I had to go to another committee's vote, so I think I might have missed the conversation on this particular bill. And we're looking at item 50, House Bill 5485, is that correct? And I just wanted to clarify, this is for a third person to be power of attorney for someone with disability, if I'm understanding correctly, and do they have to go through the court process to do that? And I apologize, I probably missed the first part of the conversation, if you can clarify.
It's totally fine. People have lots going on. Representative Dathan.
Thank you so much. It is an agreement. It is not a power of attorney. It's different. But what it does do is it enables somebody to have a group of supporters that help them through decisions like a power of attorney, but the supporter does not make the decisions like in a power of attorney. The person who has the authority of a power of attorney would be able to make an act on behalf of someone. This is different. The individual who enters the agreement makes the decisions with support from their group of supporters.
Thank you. That when you talk about a group of supporters, it could be anybody. I guess what I'm a little concerned about, and I get where you're going with this, is that this person that needs someone to help them make that decision is sometimes not capable. And I don't want them to be influenced in a bad way to have them make the wrong decision. And are there any protections in this bill for that, through you, Madam Chair?
Representative Dathan.
Thank you so much. And just like any other sort of relationship where you have a conservator or a guardian, there can be bad actors in those relationships. And, if there is bad actors, that can happen in any sort of relationship. It can be in a parental relationship as well. This bill is entered into with the individual who is capable of making decisions. And it's just a format that they can present to the bank or to a doctor and saying, I'm the one who makes my medical decisions, but I make them in connection with a decision maker supported.
Okay, thank you.
Giving you options, like if you were to go buy a car, for example. Let's say you're not an expert in cars. You go to your friend who is an expert in buying cars and you work with them and they give you maybe some advice. So in many instances in our lives, we use supportive decision making without kind of thinking about it. Right now, it's implicit in our laws, and what we're doing is we're just making it explicit so that folks know that they can do this. And it is currently, as part of our 2023 bill that we did, it is something that is part of the transition out process from school when a young person turns 18 or 21 or however long they're in the district for. And it is something that is included in that process, a description and how it works. So it's currently there, but this is just making explicit.
Okay, thank you.
Through
And
you.
just one more question for clarification. So this person that needs the support to make the decision, they are not already under the umbrella or already have a conservator or an executor or anybody else right now legally making decisions for them. They have nothing currently. Is that correct? Representative Dathan.
Thank you very much, Madam Chair. They could be currently in a conservatorship or a some sort of guardianship. They can choose to exit that if they want to do this. Just like anybody could go to the probates and saying, I don't want to be in this, and then they would go through that whole thing. Generally, we're seeing this a lot more as people are transitioning out of the school system as part of their ability to make decisions on their own.
Okay, so they would have to exit out of the current conservatorship that they have right now. They cannot do this and then that decision that they made with that other person trump what the court has already decided. I just want to get that cleared.
So in some situations, as I said, the young person is exiting the school system. They turn 18. They're no longer, their parents are no longer, they're considered legal adults. So if you don't do anything, that person doesn't have a conservatorship or a guardianship or a supported decision-making agreement in place. So if the person does nothing, there is no relationship, they would not have this. But if they go to the bank and they start trying to do something and the bank teller says, does this seem right? Or go to the doctor and saying, and the doctor might say, is this person able to make their own decisions? Having this agreement sort of is something that the individual can present to say, yes, I work with the good representative here who helps me make my decisions about where I live and things like that. You can have a team of people. You could have your parents as part of your supported decision-making team, or you can have friends or siblings. It doesn't necessarily have to be like this. But once you have a supported decision-making agreement in place, there's nothing that precludes you to then go to the courts at a later time and saying this level of restrictive does not work for this individual and a conservatorship is more appropriate. So there's nothing that would prevent someone going from either direction in this process.
Okay, thank you. I just wanted to make sure that that person is not already has a, court or a conservator and so forth, and then they go to the support person and make a decision, and then it kind of, power of attorney, then it kind of trumps what they already have directed by the court. And I just wanted to make sure that is not the case. And you're telling me that it's not. They would have to actually, before they make that decision to go with that other person, they would have to exit from the court, correct? They would have to remove that power of attorney. I no longer want that. Now I'm going to be working with this other person, correct? Through you, Madam Chair.
As a person turns 18, there is no agreement in place, whether any sort of form of conservatorship or anything. A person at that age can choose which path, the way that they want to go. The parents can help. That's one avenue of going through this process. There is also the process that somebody can exit what you're referring to, the sort of relationship, and then have the ability to take part in this relationship. But what we have seen is, as we have contemplated in the 5001 bill, is this is part of the transition process. So when you have a minor who has an 18th birthday then becomes a legal adult, they have an opportunity at that stage to enter into this sort of relationship. And there are many people, and we've heard from many people at the public hearing, that currently have this relationship in our state. And there are 21 other states that have this right now. And, we're looking at including Connecticut as part of it. There's a very famous case, Jenny Hatch, who this was a really strong ability for her to make her own decisions in her life. And she has the help of family and friends as her decision-making team.
Okay, thank you so much for the clarification. Thank you, Madam Chair.
Thank you.
I'm going to give an example that we heard at the public hearing, because I don't know where anyone is on this, but just it gave me more clarity. We had an individual who has a personal care attendant, can think very independently, but is physically disabled. And when they go to the bank, the care attendant cannot assist them. So they ended up putting the care attendant on their bank so that they could help them. This would help in that situation because that individual can make decisions on their own, but needs support. And so this is now an avenue to be able to do that. Yeah. Okay. And I know we all can't be at the public hearings at the same time. So any additional questions or comments? All right. Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5485. Representative Gilchrist.
Yes.
Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Master Francesco.
Yes.
Representative Meskers.
Yes.
Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes yes.
Representative Shake. Representative Stewart.
Stewart, yes.
Representative Vale.
Yes.
The roll call is complete.
Thank you, Madam Clerk. All right, we are now moving to number 16 on the agenda, House Bill 5486, an act concerning a diaper partnership grant program. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Dathan. Any questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5486. Representative Gilchrist.
Yes.
Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar. Senator Anwar. Representative Butler.
Representative Butler votes yes.
Representative Dathan. Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Master Francesco,
No.
Representative Meskers, Representative Pizzuto,
No.
Representative Santiago,
Yes.
Representative Scott,
Representative Scott votes no.
Representative Shake, Representative Stewart,
Stewart, no.
Representative Vale,
No.
and Senator Anwar.
Senator Anwar votes yes.
The roll call is complete.
Thank you, Madam Clerk. We are now moving to number 24 on the agenda, House Bill 5561, an act concerning Medicaid rate increases for certain providers. This is a JFS to the floor, LCO 3461. Do I have a motion?
Second.
Moved by Senator Lesser, seconded by Representative Fortier. There's been conversation today and for years about the need to increase Medicaid rates, not only to improve access to care, but also as an issue with providers and with the workforce. 2 different rate studies were done by the Department of Social Services, and yet we have yet to put a significant investment in this state to increase the rates. And so while we did not want to pick winners and losers, we were hoping for a more systemic process to increasing rates. We need to continue this conversation and elevate the fact that we are starving our providers by not paying them what we owe them. So this bill is speaking to a number of providers in our state who, because of woefully low Medicaid rates, are struggling to, again, be able to provide care, but also keep their doors open. Any questions or comments? Representative Case.
Thank you, Madam Chair. And something here that I will support, because we're going to try to do something again and actually get those rates increased to where they need to be. We have so many providers, the good chair and myself get emails all the time and have meetings with providers that just need what's owed to them. We have a study. We know what we need to spend. Let's get it out there. Thank you, Madam Chair.
Thank you, Representative. Any further questions or comments? Representative Vale.
Without any objection, I'd move to add this to the consent calendar.
Seeing no objection, we will move House Bill 5559. Nope. We will move House Bill 5561, my apologies, an act concerning Medicaid rate increases for certain providers to the consent calendar with LCO 3461. Okay. Thank you. Moving on to number 28. House Bill, this is why I got confused. House Bill 5559, an act concerning a basic health program. This is a JF to the floor. Do I have a motion? Is there a second? Moved by Senator Lesser, seconded by Representative Kit. Any questions or comments? Representative Case.
Can you just explain a little more to us?
Yes. Senator Lesser.
This is identical to the basic health provisions in SB3. This is a House bill, and it's just the basic health provisions of SB3.
Representative Case.
Well, if it's an SBC, it's already been voted on, so it's a no vote. Thank you.
Any other questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5559. Representative Gilchrist,
Yes.
Senator Lesser, Representative Case, Senator Perillo, Representative Comey, Senator Marr, Senator Anwar,
Senator Anwar votes yes.
Representative Butler,
Representative Butler votes yes.
Representative Dathan,
Yes.
Representative D'Amico,
D'Amico votes yes.
Representative Fortier,
Yes.
Senator Gaston.
Yes.
Yeah, thank you.
Gaston.
Gaston. Senator Gaston.
Correct.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Master Francesco,
Representative Master Francesco votes no.
Representative Meskers, Representative Pizzuto,
Rep. Pizzuto votes no.
Representative Santiago,
Yes.
Representative
Yes.
Scott, Representative Shake, Representative Stewart,
Yes.
Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. We are now moving to number 31 on the agenda, Senate Bill 494, an act concerning recommendations of the Bipartisan Prescription Drug Task Force. This is a JFS to the floor, LDO 3452. Is there a motion? Moved by Senator Lesser, seconded by Representative Dathan. There are future plans to change the title of this bill. You cannot do that at this point in the process. Any questions or concerns? Representative Case.
Thank you, Madam Chair. So I get it. We can't do the name change here, but through you, when did we get S language on this bill?
S language, I believe, came out this morning.
So S language came out this morning. Some pretty big things changed in here, including 340B. Never had a public hearing, and a lot of people are reaching out since we got this morning. How do we put such a drastic change in a bill? I understand S language usually comes out of what we hear in public hearing, but nobody was able to hear this because they didn't know it was coming. I'll be an absolute no, because we need to have the right to give the people their chance to explain to us what they want with 340B. We got this S language this morning, and the public hasn't had a chance. I understand S language does come to us, but at least have the decency to ask the people to weigh in on it. Thank you.
Thank you, Representative Case. Senator Perillo.
Madam Chair, thank you. I want to sort of drill into that a little bit more, and I think Representative Case makes a very valid point. But in the absence of having had a hearing, maybe we can do our best to talk about it now if someone can kind of walk me through what this new section of Section 5 does.
Senator Lesser.
Thank you. Through you, and I apologize to the gentleman. I don't have the language in front of me. I will pull it up in a second. But my recollection is that the new language replicates sections that were heard in this committee last year with respect to limiting contract pharmacies for certain entities that participate in the federal 340B drug discount program. Through you.
Thank you, Senator. Senator Perillo.
Thank you. And forgive my ignorance. Could the gentleman sort of give me a bit of an explanation of what 340B is?
Senator Lesser.
Yes, 340B is a drug discount program created by the federal government that certain providers are eligible to participate in. I believe that list includes certain safety net hospitals, federally qualified health centers, Ryan White clinics, and family planning facilities. Through you.
Thank you. Senator Perillo.
Thank you. So, and I appreciate that, but there's some sort of, is it like a rebate? Like, how does this work?
Senator Lesser.
Yes, through you. This is a it's not a rebate. It's a lower price that entities are able to purchase drugs at. Through you.
Senator Perillo.
Thank you very much. I appreciate that. And so the restriction here is for, in line 170, covered entities. What are those covered entities?
Senator Lesser.
Yes, I think that refers to as I understand it, this language refers to Yukon Health Center and to federally qualified health centers. So there's a difference between in the 340B statute, and I still don't have the language in front of me, between grantees and covered entities, and it's a question of safety net hospitals versus the health centers and the others.
Senator Perillo.
Thank you, Madam Chair. So I'm trying to understand why we've enumerated and spelled out the University of Connecticut Health Center, but not included any other hospitals in this. Was there a reason why we did that? I mean, I would usually ask, did the other hospitals weigh in? But we know they didn't because there wasn't a public hearing on this. But if there's a reason why the other hospitals, all of the other hospitals were excluded, that would be helpful.
Senator Lesser,
I don't have that information. It's a good question. Through you.
Senator Perillo,
Madam Chair, thank you. And herein lies the problem. This is why we shouldn't be adding language the morning of a meeting that never had a public hearing. I don't know what Section 5 does. I got some answers to my questions, all of which I'm sure were extraordinarily accurate, but they still don't really answer and alleviate all of my concerns. And my question about why all but one Connecticut hospital is excluded from this didn't get an answer at all. So I don't know. I mean, we've got a bill with one hospital listed. We haven't heard from any of the other hospitals because there wasn't any other hearing. This, we were doing so well, and then we do stuff like this. We don't have to go down this road. We're all adults. We can start with the right language at the beginning and debate it, and that's okay, even if it's controversial. But we chose not to do that here. And by we, I mean not me. Other people chose to do it this way. Let's have an honest debate and hear from the interested parties about what they think about the legislation we're going to pass. This bill is going to hit the floor, it's going to get a vote, and the people it impacts will not have been heard at all. There is no reason to do this. No reason to do this at all. Let's do it right.
thank you, Senator. Representative Vale,
Thank you, Madam Chair. I'm just going to echo the comments of this ranking senator, big on process here. We have a process, and obviously I feel it should be followed, and we shouldn't be circumventing that process in any way, shape, or form. And I am curious, what is the title of this bill going to be? Why does it need to be changed? And what is it going to be changed to?
it's going to be changed because these are not recommendations from a bipartisan prescription drug task force. I don't know what the name will be, but
Okay. So in essence, did we? Yes. All right. For some reason, I kind of picked up on that. That might be the case. But are we then using this in essence as a placeholder bill? Is this, I mean, because this received a public hearing based on what it's in, we're just adding, it's same bill, we're just adding a major part to it that didn't receive a public hearing.
correct.
And, okay,
So the bill itself is not a placeholder
Okay,
bill.
no.
But it does add
Okay.
additional pieces.
yes. All right, well, certainly I'm going to be opposed. I don't think we need to do business this way, and I'll definitely be opposing it. Thank you.
Thank you. Any other questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JFS Senate Bill 494. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case.
No.
Senator Perillo.
No.
Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston. Senator Gaston. Senator Gaston.
Senator Gaston votes yes. Yes.
Gaston votes yes. Yes.
Could you hear me?
Yes, received.
Yes, thank
Yes, received.
Yes, thank
Representative Hughes. Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake.
Yes.
Representative Stewart.
Stewart, no.
And Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. As a reminder, we are holding votes open. We are now moving to number 33 on the agenda, Senate Bill 501, an act concerning the Complex Rehabilitation Technology and Wheelchair Repair Advisory Council. This is a JFS to the floor, LCO number 3454. Do I have a motion? Is there a second? Moved by Senator Lesser, seconded by Representative Kitt. Any questions or conversation? Representative Case.
Thank you, Madam Chair. And this is something that we put together probably 3 years ago with this committee. Made some good progress and changes. I think we need to move forward with other things. I think the insurance committee needs to get involved with it, but instead we're going to send it over to Office of Healthcare Advocate, who's appointed by the governor. I think it doesn't need to come out of the legislative committees. I think we need to tighten up some things and see what we can get for regulations taken care of. But we're just moving it along to another agency. I'll be no on it today. I know the good chair and I have talked on this many times. We've had many meetings on it's not fair. It's something that I'm very close to as far as people getting timely repairs. I think we made some good movement on it. I just think we have to be careful. We need to make sure that they're getting what they need and we're doing what's within our purview. Some of the things in our purview have to go to the insurance committee because they're private insurance. But now we're just going to kick the ball down to another room. So I'll be against it today. Thank you.
Thank you, Representative. Any further questions or conversation? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JFS Senate Bill 501. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case.
No.
Senator Perillo.
Yes.
Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yep.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes yes.
Representative Shake.
Yes.
Representative Stewart. Representative Stewart.
Representative
How do you vote?
Representative Stewart votes yes.
Thank you. Representative Vale.
Yes.
Roll call is complete.
Thank you, Madam Clerk. We are now moving to number 34 on the agenda, Senate Bill 496, an act concerning hospital uncompensated care. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second?
Second.
A move by Senator Lesser, seconded by Representative Fortier. Any conversation or questions? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF Senate Bill 496. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case. Senator Perillo. Representative Comey. Senator Marr. Senator Anwar,
Senator Anwar votes yes.
Representative Butler,
Representative Butler votes yes.
Representative Dathan, Representative D'Amico,
D'Amico votes yes.
Representative Fortier,
Yes.
Senator Gaston,
Gaston votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Master Francesco,
No.
Representative Meskers, Representative Pizzuto,
No.
Representative Santiago,
Yes.
Representative Scott,
Representative Scott votes no.
Representative Shake,
Yes.
Representative Stewart,
Stewart votes no.
Representative Vale.
No.
The roll call is complete. Thank you, Madam Clerk. Moving on to number 36 on the agenda, Senate Bill 498, an act protecting paychecks for personal care attendants and expanding public access to state programs. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Shake. Any questions or conversation? Representative Case.
Thank you, Madam Chair. Some good testimony on this the other night. We get a lot of calls on this, a lot of calls. I think you heard the truth. We got some problems on our side. We have some policy things that we have to figure out. We have a fiduciary person, a third party who pays bills for what the policy tells them they can pay. If somebody has 20 hours and they use 25, they get paid for 20. I was always blaming the contractor because those calls are tough to get. But hear the whole story. I think we have a lot of work to do on our side. We need to make sure our policies match. When you look at this, this contractor is handed policy of the amount they can pay for services. Again, if client A gets 20 hours and their caregiver gives them 25, that third party can only pay 20 hours. There's a lot of discrepancy. 2 years there was an audit. 2 years that company's owed $15 million and we have not paid them yet. Again, we have not paid them. I defended our constituents who call. I haven't got a paycheck. I mean, this is between DDS and DSS. I don't blame them either. I think there's some policies that we need to work on. But we've had third parties in this state doing this because it's about 15,000 people that we pay. We can't do it internally, so we third party it out. If we give somebody the policy in the contract, you're darn right, that third party better follow the policy. If they can only pay 20 hours, I'm just using 20 hours because it's easy to use, they can only pay 20 hours. If they want an exception, they have to get that from our offices, DSS or DDS. That's a policy change we have to make. If they overpay somebody, which happened 2 years ago, that's the up to $15 million that we owe them because they overpaid people. They were just trying to follow the policy and help people get their money. DSS and DDS did tighten down and make sure that when they give the policy, that it's followed. Now, the company doesn't get all the reasons for why that 20 hours because that's HIPAA. We have that information in DDS and DSS. That company can't tell the person calling in why they're not getting more hours. That's DSS and DDS. We have to make that decision. I want to go very carefully on this because this is our committee's policy on how much we pay people. If we don't release more money or give more hours for people that need it, that's us. That's not the person cutting the paycheck. They're cutting it on our policy. I struggle with how I want to, I probably vote no on this to flag it. And it stinks because the title of it shows that we're not paying people who get services, personal care attendants, or whatever. But it's our policy. We hired somebody just to be the middleman to get that money out. Just like the federal government gives us money through DSS, and we have nonprofits that get that money out. This is a contractor that's doing their job, who's getting hit pretty hard. But again, we're getting pretty hard too with our constituents. If you can't get a paycheck on a Friday, you're darn right. You're going to call that person who cuts the check. But if yours is held up because they overpaid you in the past, whose fault is that? That's not the person cutting the check. I think we have some more facts we have to get. I think there's some more things that have to come in. Maybe the policy needs to change and people need some more hours. Maybe that's what it is. Is there going to be errors? Absolutely. Had there been errors with our contract with non-emergency medical? Absolutely. But if there were that many errors, why are they still a contractor with us? If there were that many errors, why wasn't the contractor relieved from his duties and gone elsewhere? This guy does 28 different states. I hope we can get more money from the PCAs, for the people that do the work for the most vulnerable people. But let's make sure we're doing our job. And let's pay these contractors their past due dollars they're holding on their book of business for over 2 years. And let's see what we can do to get our PCAs and others a little more money by increasing hours or changing our policy. Guys, this is our policy. I don't know how much more I can say that. If another person calls me, I didn't get my pay. Well, how many hours did you work? Well, I worked 30 hours. I'll have to ask and see what your policy says for you. If it only says 20, then you need to get a redetermination. Let's be real about it. I was hit so hard. Everybody was on this committee and in this building. We thought this company was really messing up. But now I find out we have guidelines that they have to follow. Those are our guidelines. If people aren't getting enough money, that's our fault. Let's work on it here. Thank you.
Thank you, Representative Case. Representative Vale.
Thank you, Madam Chair. I have a few questions. How long has this policy been in place in this run this way? You know, like, is GT Independence isn't the first billing contractor we've had. Is that correct?
That is correct.
But when did we start doing it this way?
I don't know.
All right. So it's been for a while. And it was Allied before that.
I think it's been a couple of
And
years.
it's been a couple. So that's the part for me. I'm not as familiar with this. I haven't been on this committee as long. It seems like everybody has a little bit to blame, whether we need to I just don't think the way the system's set up that it's working. I think maybe that's where we need to look into the system instead of casting blame all in one area. It seems like the state agencies, DSS and DDS have some skin in the game. Certainly, I guess GT Independence, the PCAs might not be filling. One gentleman came in and he had punched in because he got there and there was some overlap. And then the other person hadn't punched out yet, so they can't be there at the same time. So there can't be overlap. So then the person who punched in second didn't get paid at all for the whole shift. So maybe there's some system changes they can make. Maybe they need to be aware of that so they don't overlap their punch-ins. If they're in the same space, they can certainly communicate. I don't know what the answer is. And I was here for all the testimony on Tuesday, heard a lot. Definitely, if you work, you should get paid. And I don't think there's anyone that's purposely trying to keep that from happening. And I think it's something we really want to fix. We need to take a much deeper dive into this. I don't think what we have in front of us is the solution, and I can't support it for that reason. I hope that we look deeper into this into the future. If this passes, that's fine. I think even if this were to pass, we'd be back here next year having people that we need to fix it again. So let's get it done right. Let's figure out what works. And But for that reason, I'm not going to support this bill because I don't think it's going to fix the problem. Thank you.
Thank you, Representative. Yes, Representative Dathan.
Thank you so much. And I was here listening to the testimony as well. And, you know, I'm a CFO and CPA by my training. And GTI is a fiduciary. They provide payroll services. They provide background checks on employees. There are many payroll providers out there that do this stuff right, that have just as many sort of complicated systems. I mean, I see the good ranking senator nodding his head. He's been there, he's done it. He works for hospitals and knows what it means to have to bill accordingly because accuracy is essential. We are relying on them to be accurate. In that, they have had countless number of errors. They claim that they're BIPs in the sort of system, but we have an extreme amount of money that we are putting into the service. It's like $125 million. It is significant. There are committees looking at this, including my government oversight committee, and this is something that we need to look at very closely because this is taxpayer money. Maybe this bill isn't the right solution, but frankly, I think we need to address it. And we have hundreds of employees, if not thousands of employees in our state are depending on us to get this right because they need to be paid accurately. I don't think anyone, disagrees with this. But over and over again, I have heard errors upon errors, inconsistencies, ignorance. And this is not even touching upon the customer facing aspect of their responsibility in their contract. They have long call wait times, many times not even answering folks when they call in with issues. They don't have any sort of system in place that they can log a problem and find out what the system is. I mean, frankly, I am shocked as someone in my position. I have not seen this sort of inaccuracies. I do want to get to the bottom of it. We could potentially move to another provider and have the same problem. So yes, it has to be looked at holistically. But frankly, I think throwing our hands up and saying, no, we can't do anything is not a solution for today. And with that, we have our core CT system that processes, about 50,000 state employees, and we don't have this sort of issues with our state payroll system. I don't know if that's the right solution, but we need to be thinking about it. And I commend our leaders to take a chance and get some answers and try to work through this problem because it needs to be solved. Thank you, Madam Chair.
Thank you, Representative. Yes, I understand that there are many bills, I believe, or a handful moving their way through the process to address this issue. I would just say, these are some of our lowest paid workers in the state, and to not have them receive pay is unacceptable. So we need to do something to fix the problem. Any questions or comments? Yes, Representative Case.
Again, I've been here 14 years and I think I'm on my third contractor doing this. Nobody bids it. We have people bid this business. If they aren't doing the job, then their contract needs to be called. And that hasn't been done. So there's fault everywhere. I explained to DSS and to this contractor, let's have some informational sessions. Let's do some campaigns out there to help the PCAs. And in DDS world, it's new quote unquote providers that are trying to log in and start being a provider, that it's not the easiest process. But I think we have to educate, and I think we're going to see if we start digging deeper, we need to pony up. People need some more hours. There's some more complex situations out there. And if we're limiting hours, that's on us. And DSS and DDS will tell us that. I think we can't be afraid of a fiscal note. We can't be afraid to hold a contractor to their contract. And I agree with that. But if there are so many faults, why is the contractor still here? I look at that. We had the problem, and I keep bringing it up. Any non-emergency medical we put it out to bid because we weren't happy with the contractor 10 years ago that we had. Then we got another contractor. Now we have another contractor. So we're on fourth contractor with that since I've been here. I get it. Contracts are contracts, but I think we need to do a campaign with these workers and make sure we find out what the faults are. And if some of those or part of those are because we're not allowing enough hours to do the job, we need to take a look at that. But we can't take a look at it and have them come back to us and say, well, they need more hours, but we don't have the money. Be careful. I can see that happening. I want to make sure these PCAs and the people that they're giving the aid to get the hours they need. But are we going to pony up and give them the more hours? We have to. Go at it again, guys. 12, 13 years, no rate increases. I bet you there hasn't been hour increases for people either. So let's take a look at the whole thing. I wholeheartedly agree. We've all gotten phone calls on this, but we got to drill down. Take the blame. Everybody needs to take the blame. I think the representative said there's thousands of people. I think they said 13,000 people they pay. Hundreds of millions of dollars. It is. It's our money. But let's drill down. Instead of blaming, let's figure out what's going on. And if it's us, let's take the blame. Thank you.
Thank you, Representative. Any further questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF Senate Bill 498. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case.
No.
Senator Perillo.
Yes.
Representative Comey. Senator Marr.
Senator Marvin, yes.
Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Master Francesco.
No.
Representative Meskers.
Yes.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake.
Yes.
Representative Stewart.
No.
Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. Moving to number 38 on the agenda, House Bill 5540, an act concerning the mitigation of benefit cliffs. This is a JF to the floor. Can I have a motion?
So moved.
Moved by Senator Lesser, seconded by Representative Kit. Any question or conversation? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF House Bill 5540. Representative Gilchrist. Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yeah.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Could you say that again, please?
Representative Hughes votes yes.
Thank you. Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Mastro Francesco,
No.
Representative Meskers,
Representative Meskers votes yes.
Representative Pizzuto,
No.
Representative Santiago,
Yes.
Representative Scott,
Representative Scott votes no.
Representative Shake,
Yes.
Representative Stewart,
No.
Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. Moving on to number 39 on the agenda, Senate Bill 479, an act concerning oversight of federal fund applications by the Department of Social Services. This is a JF to the floor. Do I have a motion? Is there a second? Moved by Senator Lesser, seconded by Representative Dathan. Any question or comment? Seeing none. Oh, so close. Senator Perillo.
Yeah, you're close, but no cigar. If you don't mind, could I just get a brief explanation of what the bill does?
Yes. So this bill would require DSS, the Department of Social Services, to forward the application for the Rural Health Transformation Program grant and technical assistance to the Human Services Committee at least 30 days before submission to the federal government. And then the committee, if the committee does not vote on the application, it would be considered approved. If the committee does vote, DSS will comply with the committee's decision.
Thank you.
Any further questions or comments? Not seeing any. Would the clerk please call the roll?
A motion has been made and seconded to JF Senate Bill 479. Representative Gilchrist. Senator Lesser. Representative Case. Senator Perillo. Representative Comey. Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes.
Thank you. Representative Butler.
Representative Butler votes yes.
Representative Dathan. Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Mastro Francesco.
No.
Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake.
Yes.
Representative Stewart.
No.
Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. Moving on to number 41 on the agenda, Senate Bill 481, an act establishing financial safeguards for private equity ownership of nursing homes and prohibiting required arbitration agreements. This is a JFS to the floor, LCO 3439. Do I have a motion?
Second.
Moved by Senator Lesser, seconded by Representative Fortier. Any questions or comments?
Yes.
Yes, Representative Meskers.
So I just want to thank the good chair for bringing forward this bill. But, you know, I want to highlight the issue. It's not the issue of private equity making an investment in the ownership of nursing homes. It's really, the problem is the regulatory framework we have for how we manage our nursing homes or oversight. And I'll make this time and time again. The state is dedicating resources to taking care of its most vulnerable residents. The ownership, whether it's individual or under private equity, needs to be monitored. We need to make sure that assets aren't stripped from facilities that provide for our most vulnerable, that we don't end up in bankruptcy with no assets underneath for those that ownership issues. And so I would say, rather tongue in cheek, the private equity ownership problem or the problems with certain investors is not the problem. It's that they have found that our legislation is got too many holes. And the regulatory framework needs to be improved to make sure that if we're going to rely on the private sector and nonprofits to provide care for our vulnerable residents, we've got to make sure that we have the right process to hold them accountable and make sure the assets don't disappear so that we're left trying to reconstitute entities. You know, in reference, I think we have this issue with some of the hospitals. You know, I won't mention names particularly, but we have that issue. And I think we need to move forward and make sure that we're securing the future. So I'm going to support this. I'm not sure it's actually where I want to be, but I think it sends a message. So I hope that the regulatory framework is improved. Thank you.
Thank you, Representative. Representative Case.
Thank you, Madam Chair, and I thank the good representative for his words on that, because I don't know who's been in a nursing home lately here. They're pretty disturbing. Folks, if we go out and we pay the reimbursement rates and the rates for what they have, for what they're supposed to be, they wouldn't have to bring private equity in. Private equity is what's helping the bricks and mortars of these facilities. They're not getting a rate that's actually covering what they need to serve. I mean, I get in and I see these nursing homes, and I wish, you know, we could see, yes, what they're paying or what they're putting towards each patient, but what they're putting towards the building and the bricks and mortar. I have one of the lowest reimbursed nursing homes in my district. I fought for them. They've gotten a small increase. I mean, you wouldn't even want to know what they were reimbursed on a daily basis. It was the lowest in the state. And I thank DSS for going out and redetermining and seeing what they can do. But these buildings aren't getting any better. I think the regulatory things that we have to look at on how things are done is where we need to go, not to restrict. But the private equity is the only ones that want to put money into the buildings. I think we have to look at the rates, see what we pay, see what we do. These are our most vulnerable people, our mothers, our grandmothers that are in these facilities. Let's spruce them up. Let's make it a place where it's okay for them to be. I'm scared to death. I have a father-in-law in one right now. It's scary. So think about what we're doing. I can't pass this out. I worked on this bill last year. We got to invest in the facilities that we put our own people in. If we don't do that, who else is going to invest in? If it's not us, somebody else has to come in and do it. Be careful. We want a good place, not only in the nursing homes, but our group homes. You will be involved with them someday, either with a family member, an extended family member, but you want to have a decent place for your end of life. Thank you.
Thank you, Representative. Representative Pizzuto.
Thank you, Madam Chair. Just a comment. I think we're generalizing across the population of private equity owners. And to my good ranking member, there's a lot of those convalescent homes and nursing homes that don't have air conditioning. They pay PCAs and CNAs the lowest you can imagine to take care of our most vulnerable population. So without a large infusion of state money, we have to count on private equity people, but let's hold them to the performance bonds and things along those fiduciary responsibilities that we expect, and hold them accountable that way, but not just simply generalize and ban them all. So just a comment. Thank you, Madam Chair.
Thank you. Yes, Representative Kitt.
Thank you, Madam Chair. I want to offer my experience with private equity in one of the largest nursing homes in the state, which is in my district. It was formerly owned by the Diocese of Connecticut, one of the highest rated nursing homes in the state. And in the over the last year, we had several closings because of Legionnaire's disease and other problems since private equity took over. And the nursing home has since been closed, and all of those residents were forced into, some of them out of state. So my experience with private equity ownership of nursing homes has been less than positive in my district. And I think we need to have more oversight, more control, and more limitations. And I think this bill is a good start. So
thank you, Representative. Yes, Senator Perillo.
You know, I know the facility that Representative Kitt is referring to, and I share her thoughts on that. But at the same time, I know family-owned nursing homes that I don't have very high opinions of either. So, you know, I completely understand where the representative's coming from and where the proponents of the bill are coming from. I don't know that I'm willing to go so far as to label an entire class of owners in the same way. So I'm eager to hear more thoughts on this, but I just think we have to be careful when we start dividing up how we treat healthcare providers based upon who owns them, or what, not even who, but what type of person, company, whatever owns them. It's a slippery slope. But I appreciate those thoughts, and I'm familiar with them, and I would agree in that particular case.
Thank you, Senator. Senator Anwar via Zoom.
Thank you so much, Madam Chair. I just wanted to mention from a medical literature perspective, it is actually the death rate is 11% high based on the ownership. If a nursing home is owned by private equity, the death rate is 11% higher. Thank you so much.
Thank you, Senator. Any additional questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JFS Senate Bill 481. Representative Gilchrist.
Yes.
Yes. Oops, sorry.
Senator Lesser.
I was so excited. Yes.
Representative Case. Senator Perillo.
No.
Representative Comey. Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Stone votes yes.
Representative Hughes.
Representative Hughes votes yes.
Can you repeat that, please?
Representative Hughes votes yes.
Thank you. Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco. Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake.
Yes.
Representative Stewart.
No.
Representative Vale.
So down in the dumps, every guy here'd love to be you, Gaston.
I'm sorry, I don't know what happened there, but Representative Vale votes no.
Roll call is complete.
Just a little PSA, The Beauty and the Beast will be playing at the Bushnell in the next month.
I love it.
All right, now moving on to number 42, Senate Bill 428, an act concerning legislative oversight of Medicaid waivers, Medicaid state plan amendments, and other federally funded programs. This is a JF to the floor. Do I have a motion? Second?
Second.
Moved by Representative Kitt, seconded by Senator Lesser. Any questions or conversation? Representative Case.
Thank you, Madam Chair. So legislative oversight, through you, how many waivers are there?
How many waivers in a given year?
Yes.
I am unsure.
Hundreds? Thousands?
No, I would think hundreds. Hundreds or less.
My concern is
Yeah. Like 30. My guess is around 30.
your intent, through you, the intent on this is to have the legislature come in like we do for waivers, for all waivers. Is that correct through you?
Senator Lesser.
No, it's a gentleman raises some excellent questions, and so the intent is to inform this committee to make sure that we know when a waiver is being submitted, so we can make a decision and know what's going on through you.
Representative Case.
So through you, there's nothing in here that triggers that we will have to meet on every one. Who is the deciding factor on if we meet on them through you?
Senator Lesser.
The chairs.
the chairs of the Human Service, right? Representative Case.
Thank you, Madam Chair. So just the chairs will decide if we need to hear something on the waivers through DSS.
Senator Lesser.
Yes, the chairs can call a meeting whenever we want to. That's the nice thing about being a chair. But you'll appreciate that we choose not to do that too often because we respect this as a citizen legislator, and you all have other things to do in your spare time. So we try not to abuse our prerogative in that respect.
Representative Case.
Thank you. I think oversight is oversight for everybody. I think both sides should be involved and both sides should ask. I'll be voting no. Thank you.
Thank you. Any questions or yes, Representative Dathan.
The Human Services meeting and the Appropriations meeting meet regularly to talk about any sort of waiver. It is part of our legislative process and when we do this. So I don't think that there is not a non-approval process. There's not waivers being submitted that are outside of the appropriations process because we do it all year long. But there may be an example where there's a change in a waiver that doesn't have any financial implications or that we have to make an amendment on. And I think that is my understanding as part of this change.
Thank you, Representative. Representative Case.
Thank you, Madam Chair. And the good representative is correct. And we come in when we're called in for those waivers. DSS has the ability to say, hey, we got to change. We'd like your input. We'd like a vote. Why do we have to override them now? If we are going to override them, we are going to be called in for more meetings. There's hundreds of waivers. They're 500 to 1,000 pages long. I think we should have both sides be available to say, hey, maybe we ought to look at these waivers. We're coming in now. You're correct. But we're just coming in for a few because they're being conscious of our time. We could be in all summer on these waivers. I'm just saying. They're big waivers, and they call us in and they send it to appropriations. I think Susan's not here anymore, but the clerk of appropriations will say, hey, we got to get both committees together, whether it's human services, appropriations, public health, wherever the waiver comes out of. But you're correct. We get called in when we need to. Now we're going to tell them when they need to come in. So we'll be in more often. Appreciate it.
Thank you, Representative. Senator Lesser.
I just want to clarify so new waivers do come to the Appropriations and Human Services committees, and that process works. The requirement, though, is that for other state plan amendments that might change Medicaid and have enormous impact on our state's budget and on our policy set by this committee, that is up to DSS right now when to come and when not to, and that they are supposed to determine whether or not it's major or not. If it's a major issue, they're supposed to come before us. If it's not a major, that is they don't have to come before us, and that is totally subjective. There's no requirement. We're not saying that we're going to hold a hearing on everything, but they should notify the chairs and rankings of this committee about the members of the committee about actions that could affect the state budget, and that is something that is a vital role of this committee and the Appropriations Committee is to have that oversight over our state taxpayer funds and the actions of the Department of Social Services. And so this is something that should have bipartisan support. You know, if they're spending money and they're not telling us about it, that's a problem. And so that doesn't mean we have to have a whole hearing, but they should at least in writing notify us what they're up to. And I think that would provide additional safeguards. Right now, it's just totally up to their discretion as to whether or not to consult with us or not. And that to me seems wrong. There you go.
Representative Case, followed by Representative Meskers.
Thank you. And I just heard key words, and out of the senator, his comments, it would be going to the chairs and the rankings. Is that correct? So this would go to the chairs and the rankings.
Senator Lesser.
Oh yes, absolutely. Three.
I just heard before it would just go to the chairs.
Senator Lesser.
No, to clarify, the question was whether or not the rankings could convene a meeting. No, the rankings can't convene a meeting. But in terms of notifying, this bill would require DSS to notify the chairs and rankings of the committee about any change in policy when that affects the budget. And I think that is important information that the chairs and rankings should have access to and should be able to communicate to our respective members. Three.
Okay. Representative Meskers.
This is deeper into the weeds than I have ever wanted to get to. And to be perfectly honest, So my concern and question is, these are changes are happening automatically. We're not getting the oversight we feel we need. So does the bill call for a review? Does the bill call for that it be deemed approved if we fail to respond? Because if someone is either at work, on vacation, or in terms of the leadership, are we going to delay the turnaround time for the approval of the needed waivers and waiting on our approval? So it's more, I think I understand the intent is to have oversight. I guess the question is, will the oversight gum up the process to a point that makes it unworkable? So I don't know whether maybe you need to run a dual process for 3 months or 6 months where you're notified. They operate under the existing procedure. We see if we can turn around responses, because I just am concerned that the function of government, and we all know what the function of government looks like currently. We want to be careful. So that would be my observation. Is if we don't figure out the trial for this, I'm worried about implementation. So I would probably be a no without some agreed work on trying to get to a yes.
Thank you, Representative. Senator Lesser.
Yeah, just to be clear, there's no requirement that the legislature has to approve it. It's just an ability for the legislature to hold a hearing, the committee to hold a hearing if it wants to.
But with the time frame of response, does it require that we respond before they can enact the waiver, or they can move ahead and inform after the fact?
Correct.
So, okay, so they can go ahead. It's just to inform us on what they've done.
Right. We have the ability to, through you, Madam Chair, we have the ability to pump the brakes if we want to, but there's absolutely no requirement that DSS, there's no requirement that the legislature do anything, and that we're not trying to slow down their ability to seek federal funds. Right.
Okay, through you, Madam Chair, or removing their authority to approve the waiver. We're just asking for a review process. Is that categorically to understand it?
Senator Lesser.
The gentleman's correct. 3.
Thank you.
Great. Any further questions or comments? Seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF Senate Bill 482. Representative Gilchrist.
Yes.
Senator Lesser.
Yeah.
Representative Case. Senator Perillo. Representative Comey. Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes. Sorry.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yeah.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
No.
Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes no.
Representative Shake.
Yes.
Representative Stewart.
No.
Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. Still talking about Beauty and the Beast over here. Okay, number 43. Senate Bill 478, an act concerning consumer safeguards for long-term care policies and administration of the Connecticut Partnership for Long-Term Care. This is a JF to the floor. Do I have a motion? Is there a second? Moved by Senator Lesser, seconded by Representative Kitt. Any questions or comments? Representative Case.
Thank you, Madam Chair. I'd like to make an amendment and move this to the Insurance Committee through you.
Is that an amendment or
A motion.
Okay. A motion. All right. A motion has been made for a change of reference.
To the Insurance Committee.
There's a motion on the floor to
Change of reference, isn't that the term? To the insurance? Yes. So we need to, no, but don't I need a First, so we got the motion. Is there a second? Seconded by Representative Mastro Francesco. Any comments or questions? Senator Lesser.
Yeah, we, after Bill's, the motion is right now to, there's a motion on the floor, there's a motion right now to JF to the floor. After this bill gets to the floor, this goes to screening committee, and it could go to, the screening committee will refer, there's House, Senate, Democratic, Republican screening committees, and where it goes after us is beyond our control. So we would be open to it going to insurance or wherever else. But at this point, we recommend, like with all of our other bills, some of them will have to go to judiciary, some of them will have to go to appropriations or to other committees. I think the easiest thing that we're recommending is that all of our bills go to the floor, and then we'll let the screening committees of our respective caucuses make that decision. So would respectfully oppose the amendment.
Did I?
There's a motion made and seconded to refer to the floor. That's why I'm not sure if you can do a referral.
I think Jay's motion was the first motion.
I'm going to ask the clerk. When I brought this up, did I make a motion? Yeah, didn't I? To the floor.
No. Was there a motion to move it to the floor?
And Kit. So there was an original. We're all just getting a little tired. Okay, Representative Case.
My concern is this bill's been to us before. This bill's in the aging committee. I said this in the aging committee. We don't have purview over private insurance. Private insurance is the insurance committee. We can hear it. We can try to make it. We don't have purview. It's not the human services purview. I get the issue. Rates are going up, but they're not state rates. They're private insurance rates. I'll hold to it. I'll talk to the chairs of the screening committees and get it to insurance. If we do it, the insurance industry is going to fight it because we don't have the purview to make this law. It has to go through the insurance committee. Thank you.
Thank you, Representative. I would say that why we do have this in our committee is that we have a Connecticut partnership plan that encourages folks or offers folks to take part in these long-term care policies. And so because of this practice happening, we're seeking to address it through that lens. Representative Case.
Thank you. And I agree with that. It's a terrible issue that's going on, but it needs to go to the proper people in the insurance committee. They make the decisions with the private insurers who sell these policies. Human Services doesn't sell these policies. DSS doesn't sell these policies. We have a purview. It needs to go to the insurance committee.
Representative Vale.
And you mentioned a partnership for who has purview over the partnership for long-term care? I'm well aware of how this works.
Senator Lesser.
I'm just curious.
Yeah, well, so the Partnership for Long-Term Care, and I would appreciate anybody else in the committee weighing in here, but my understanding is that this is a program involving DSS, which we clearly have cognizance over, and OPM, and is administered by OPM. And the idea is that it's pre-certifies certain long-term care insurance policies, and we say people who policies that participate in this are able to receive Medicaid benefits without achieving the spend down. And this is a way of allowing people to not exhaust their assets when they're aging and needing long-term care services. So it's clearly an insurance issue, but it's also a human services issue, and that's why.
Okay, and in this committee, we deal with issues with the Partnership for Long-Term Care. Okay. I get the good representatives thing. I do think this is a big insurance issue, but I don't see any reason why we can't bring it here. So I will be opposed to the amendment. Thank you.
Thank you, Representative Vale. Any additional questions or comments on the change of reference motion? Representative Mesker.
I want to be mindful and respectful of this committee, but I do sit on the insurance committee. So I would prefer due consideration of referring this to the insurance committee, and I can't find my way around supporting the bill without reference to our insurance committee. So I think it needs to be referred to the insurance committee. Thank you.
Thank you. Just going to stand at ease for a moment to make sure we're doing the right thing. right, we're going to call the meeting back to order. And I would like to ask Representative Case if he would withdraw his motion to modify the motion to the floor to insurance.
There's a lot of technical things involved here. If we do the motion, we have until 5 o'clock. Insurance deadline is at 5 o'clock. We'd have to wait till 5:01 to refer. I will withdraw the motion and hope that the other screening committees will move this to insurance where they have purview over this.
Thank you, Representative. Representative Meskers.
Just as a member of the Insurance Committee, I would second, appreciate the motion and make my land claim or grab, and I will go up and make the screening committee duly suffer my presence and try to get it moved to insurance. Thank you.
Thank you, Representative. All right, now we are back to the underlying bill. Any questions or comments? Representative Vale.
Thank you, Madam Chair. I'm gonna support this bill, whether it should be in insurance or aging or wherever. I do think there's purview here. We listened to a lot of testimony. You know, this is the insurance capital of the world. You know, you have different type of policies. This policy is a little bit different. If you listen to the testimony or look at the written testimony, all the errors in assumptions, they talked about assumptions a lot, which is big in the insurance industry, but it's based on data. They have the best actuaries in the world to work on this data. The excuses they make are, oh, this was new and it went off life insurance data in the 70s and 80s, 1974, I think maybe they started. But most of the people that purchased policies in the 70s are not with us anymore. Okay. And so what's the excuse they have for still selling these policies and not doing the proper math in the 90s and the 2000s and so on? Again, this is much different than, and excuse me for repeating myself, but it's just, I want to make sure people understand that these policies are different than your conventional medical policies. Car insurance goes up because the cost of vehicles goes up, the cost of maintenance goes up. So when you have to repair them, it goes up. Same with homeowners insurance, same with medical, you know, major medical, it goes up. Hospital prices, doctor prices, all that stuff goes up. This policy is a set dollar amount. And it's yes, very much like life insurance. And you buy a specific amount. So whether the cost of care goes up or not is irrelevant. You're buying a bag of money that you can use for long-term care. And I have a lot of concerns. And we talked to people here that their premiums have started at $1,000 a year, and now they're up 350%. And there were some that were even more than that. They did their due diligence. And this is one of the most strictly underwritten type of policies there are. You have to be healthy to get one. And if you do the right thing and buy one at an early age to protect your assets so that you want to be able to hand that stuff down to your family and not be a burden on them. And I use that term. We all don't consider it a burden, but a financial burden it can be if you have to send somebody to a nursing home and they have the wherewithal to plan ahead. And it's based on when you buy the policy. And that's the key. And in the policy, it will say they're able to increase premiums. But there should be some type of assumption if data hasn't changed that it should stay pretty level. And I don't know if they purposely did stuff to keep rates low to hook people in. I'm not saying they did. Some people are saying that. That could be the case. I'm not saying it is. Or they're just not good at their job when it comes to this, and they're not using good math and good figures. And and then all these assumptions they're making, and then they talk about they didn't get as much on investments. That's their problem. They have to figure that stuff out and how long their money could go. And they have to be bringing new healthy people into the plans. That's how this goes. It's like one big Ponzi scheme, but that's how insurance is. That's what it is. You bring new people in and that premium pays for the people that need the service. And that's what keeps the cost down. So we spread the risk. And that's all on the insurance industry. You should be able to trust them, that they have good people in place, and that you can expect that the premiums are going to stay relatively flat. Now, if they made a mistake initially, then how come there's not just one fix? Okay, these were the numbers. Why is every year they're asking for more premiums? And they stop selling a lot of these policies, which is on them. And so you don't have more new money coming in. So it's an industry issue. It's not a consumer issue. But what are they doing? They don't want to take a loss at all. And again, I don't begrudge them making a profit. They need to. They deserve to. We need insurance companies here. But when you make a mistake, you need to own it and have ownership of it. And they're not stepping to the plate. I'm disappointed that there's no testimony here from the insurance department. I think they're at fault in this. And we talk about the Connecticut Partnership for Long-Term Care, very well intentioned and put in place. I think that needs to be looked at again, because if they're rubber stamping all these policies and this is happening, people are going to put more trust in a policy that has that emblem on it than they are policies that don't. And now people with the partnership plans are having the same problem. I think the state is culpable in this as well as the insurance industry. Even, OPM testified against this. And that's where I think in their oversight of the partnership, I think we need to if we really want to fix this problem, we need to be everybody to the table, hold people accountable and have real conversations about what we can do to fix it. I don't know if this bill is going to do all that, but we need to keep having this conversation. It's a big problem. And I don't know that it gets enough attention. So I appreciate the leaders of this committee for bringing this out. I'd be happy to be part of a solution. I don't know what the solution is, but just kicking the can down the road and keep jacking up the rates of the insured is definitely the wrong approach to take to this. And this bill, put some of the onus back on the insurance industry and others. So I want to support this today and moving forward as well. But I'd really like to see, I get a feeling we'll see this again next year, knowing the influence the insurance has in this building. I would just suggest that my colleagues don't worry about that and do the right thing. Thank you.
Thank you, Representative. Representative Butler, followed by Representative Case.
Thank you, Madam Chair. I first of all would like to concur with some of Representative Vale's observations. After working in the insurance industry for a couple of decades, some of his observations are right on the money, and these areas should be addressed. And I also agree that it should be addressed in the insurance committee. So I also have a seat at the screening table and will strongly suggest that it's referred there so they could actually take it up, seeing that they're probably the more suitable committee of cognizance. So again, I think that this really needs to be looked at because the insurance industry doesn't look like it's really kept up with how this initiative has evolved over the years, and these areas that was brought up need to be addressed. So thank you for the opportunity to share that, Madam Chair.
Thank you, Representative Butler. Representative Case.
Thank you, and I thank all the comments, and I hope we can make this happen and get it to insurance. It's been an issue that's come before us a few years. It just came through us in aging also, and I hope the process works. With that, can I move this to the consent calendar, please?
If there are no objections, we will move this bill, Senate Bill 478, to the consent calendar. Thank you. All right. We're on to our final bill, but we will have a consent calendar to vote on. But heading to number 9, Senate Bill 327, an act expanding emergency Medicaid coverage. This is a JF to the floor. Do I have a motion? Moved by Representative Kit, seconded by Representative Shake. Any questions or comments? Yes. Of course, I didn't pull up my notes. Yes, this bill, as the title says, expands emergency Medicaid coverage, including some of the things that would be considered emergency Medicaid. I believe that's the full expansion. I'll find my notes in the meantime, but that's Senator Perillo.
Thank you, Madam Chair. Just so, and I'm just looking through my notes too. It's been a long day. Apologies. Does an individual's immigration status have anything to do with the expansion of emergency coverage?
Individuals who are undocumented are already covered by emergency Medicaid in the state of Connecticut, so this does not change that. Any additional questions or comments? All right, seeing none, would the clerk please call the roll?
A motion has been made and seconded to JF Senate Bill 327. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case. Senator Perillo. Representative Comey. Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan. Yes. Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
Representative Master Francesco.
No.
Representative Meskers.
Yes.
Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott is a no.
Representative Shake. Representative Stewart.
Stewart, no.
And Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. I'm going to call out the numbers. How will I do it? I think I will do what number they are on the agenda and their House bill, but I'm not going to say the titles since we had already done the titles earlier for the consent calendar. Oh, the clerk will read the, okay. Then, whoops, awesome.
No, we should read the consent calendar.
Okay, then I will, would the clerk please read out what is on the consent calendar?
The consent calendar contains HB 5357, HB 5054, HB 53. Oh, I'm sorry, was there an issue? Mhm. Yeah, 5040, HB 5354, SB 329. HB 5480, HB 5484, HB 5487, HB 5481, SB 430, SB 433, SB 431, SB 429, HB 5556, HB 5561, HB 5557, HB 5558, HB 5562, SB 499, SB 500, SB 495, SB 480, SB 478, and SB 331.
All right, thank you, Madam Clerk. Yeah, no, thank you. Would you please call the roll on the consent calendar?
Representative Gilchrist,
Yes.
Senator Lesser,
Yes.
Representative Case,
We need a
Oh, and yeah.
motion to.
Do we need?
No.
we already did at the
We already did
beginning.
that.
Yeah.
Can't remember how to do it.
All right, Senator Perillo. Representative Comey. Comey? Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes.
Thank you. Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston.
Senator Gaston votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco.
Yes.
Representative Meskers.
Yes.
Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Representative Scott votes.
Representative Shake.
Yes.
Representative Stewart.
Yes.
And Representative Vale.
Yes.
The roll call is complete.
Okay for votes? Your people,
You don't
you're
have
good?
anybody, so whatever.
Okay.
Yeah, but
Uh,
some people may have missed a couple.
Okay. All right, we are going to hold the votes open until 5:30 on Zoom and in the Human Services Committee. Thank you so much to everyone. That completes our committee work. Well done, team. Thank you to the staff, the amazing staff. Woo!
Madam Clerk, can I record votes that I missed?
Yes.
All right, Representative Hughes, go ahead.
Item 1 that I missed, yay.
Yes on the one you missed?
Yes.
Okay, I have it recorded.
Did I miss any others?
I do not believe so.
It was just the first one, right?
Mhm. All right, thank you.
Thank
I
you,
would
Madam Clerk.
also like
For
to,
everyone else online, I will move into the clerk's office in one moment so I can hear you because the rooms become quite loud, and then I will take your votes.
okay.
Thanks, lady. You were really kind to let me in.
The state representative and Bob. Let me see something. I think you might be.
Senator Mar, you are not
Yes.
muted.
I'm,
Don't get-
I'm sorry, go ahead.
I was just saying you're not muted. Just want to
Oh,
make
thank
sure
you. Thank
don't
you.
end up- Good to see you.
You too.
And I good to see you, Representative Butler and Senator Gaston.
Senator Gaston is French.
Yes. See.
Yeah. We.
We.
We. See is Spanish.
We. Yes.
We.
Yes. We.
So it's
Senator
good to see you, Senators Anwar and Gaston.
All right,
I'm
sorry,
gonna have to
everyone.
remember that enunciation.
Can everyone see and hear me now?
Yeah.
Yes.
Okay, thank you for your patience. I was having technical difficulties. All right, Senator Gaston, you are on my screen now, so you get to vote first. And also, how am I supposed to say your name?
Yeah, that's how it's French. That's how it's supposed to be said. But
Okay.
I've settled for Gaston because everybody say it, and so it's just easier. But anyways, my dad was on CT and he's like, "Your name is Gaston." I'm like, "Okay,
So,
Dad, whatever."
The first time I did roll call on this committee, I said Gaston, and everyone corrected me to Gaston.
Yeah, I know. You did. You said it right. But I wanted to see if I missed any votes. I don't think I did because I've been on for a while, but I just want to double check.
Let's see. No, I think I have you for everything.
Thank you.
Mhm,
And
thank
thanks
you.
to my amazing colleagues. See you all later.
I'm in this similar boat. I think I
See you
voted.
later.
Senator Anwar? Yes.
Yes.
Yeah, I don't think you missed anything.
Perfect. Thank you.
All right, thank you.
How about me?
I have you for everything too, Representative Santiago.
Thank you.
Thank you. All right, Representative Butler?
Oh, yeah. So I believe I missed one.
You missed the first one, yes. It's a SB 87 and Act Strengthening Nonprofits.
Representative Butler votes yes.
All right, thank you.
Thank you very much for everything you do.
Thank you. And Senator Marr,
I don't know how many I missed, but I know I missed the first.
you missed the first several, yeah.
Yeah.
So SB 87 and Act
Yes.
Strengthening Nonprofits. You're a yes?
Senator Mar votes yes.
Okay. SB 3,
Yes.
I assumed, yeah. HB 5041, an act
Yes.
expanding healthcare coverage, yep. HB 5482, this is 12-month coverage for contraception and hormone therapy.
Absolutely.
HB 5483, an act concerning fertility care under the Medicaid program.
Absolutely.
And SB 497, food security for veterans and others.
100% yes.
5358, an act concerning the rebasing of rates of reimbursement for certain residential facilities.
Yes.
HB 5356, an act concerning non-emergency medical transportation.
Yes.
SB 328, an act requiring nursing homes to spend 80% of revenue on direct patient care.
Yes.
SB 326, an act concerning Husky C asset limits.
Yes.
HB 5485, an act concerning supported decision making.
Yes, definitely.
HB 5486, an act considering a diaper partnership grant program.
Yes.
HB 5559, an act concerning a basic health program.
Yes.
SB 494, an act concerning recommendations of the bipartisan prescription drug task force.
Yes.
SB 501, an act concerning the complex rehabilitation technology and wheelchair repair advisory council.
Absolutely. Yes.
SB 496, an act concerning hospital uncompensated care.
Yes.
And then I have you after that.
All right, great. Thank you so much, Madam Clerk.
Thank you.
Bye.
Bye.